Okay, calling to order the Joint Committee on Ways and Means and Health and Human Services. So this morning, we're going to hear from Department of Health, who will present their supplemental budget requests. Good morning.
Morning, Chair. Chair Dela Cruz, Vice Chair Moriwaki, committee members, and Chair San Ventura. I'm Kenny Fink with the Department of Health. I'm here today with First Deputy Val Cato, Acting Deputy Director for Behavioral Health, Dr. Courtney Matsu, Deputy Director for Environmental Health, Kathy Ho, and Deputy Director for Health Resources, Debbie Moriwaki, and a number of staff in the audience. We are here to answer your questions. I'll give a brief presentation to get us started. Okay. This is from the World Policy Uncertainty Index, and you can see in the past year it has spiked. We have experienced lots of uncertainty in our interactions with the federal government during this last year. There's been a number of issues of policy uncertainty, particularly around vaccinations, but also decisions by the FDA. So in a lot of our interactions with the federal government, there just continues to be a significant amount of uncertainty from a policy perspective. That has impacted trust. So this is a Kaiser Family Foundation survey that was conducted in January of this year, which is in blue, and it's compared to June of 2023 in green. And you can see kind of across the board, trust in people's doctors, the CDC, and their local health department has declined over that period. So that is a challenge for us, as it is important that we are trusted in our information. This is just a little more detail for your reference on how it plays out and how the trust has declined. I do just want to highlight that the greatest trust that people have is in their doctor. So the importance of access to care and the usual source of care is incredibly important for people to be able to make informed choices. Okay. In addition to the policy uncertainty, there's been resource uncertainty. There's a little bit of timeline. I just want to highlight that March 25th, the rescission of COVID supplemental funding. We received notification that these supplemental grants were terminated effective immediately. We spent an inordinate amount of effort understanding the impact of those funding cuts. There was subsequently a preliminary injunction, which became a permanent injunction, and those funds were restored. So with a tremendous amount of effort, we ended up in the same place. But what has persisted is the requirement for how additional information we need to submit and exercise to draw down federal funding. So it's still accessible, but it requires more effort. Other notable one was October 10th, which was the federal shutdown. During that time, as a result of reductions in force and then people leaving, the CDC staffing had been reduced by about a third. A lot of that has been restored, but we're still working to understand the status of a lot of the programs at the CDC. How that also impacted us was the WIC funding. So during that shutdown, there was no funding for WIC, so we had to move funds around to ensure that the WIC program continued without interruption. Okay, as we look at the House and Senate markups of the appropriations bill for this fiscal year. So the continuing resolution only goes through January, as you know, and there's uncertainty for what our budget will be for this fiscal year. For most of the upcoming state fiscal year, it was funded through the previous federal fiscal year. So it may impact what we currently have, but it will significantly impact next state fiscal year, which is what we're talking about in our budget today. The House has about a 19% decrease compared to last year, where the Senate is relatively flat. The areas that have been identified for potential cuts are noted there on the right. So again, this is just an area of uncertainty as we're looking at that. As we look at communication, both in those markup bills, other policy statements and activities by the federal government, these are areas that we've identified to be at higher risk of reductions in funding, and these are the reasons why. This impact is about $80 million in 80 positions. These are not included in the budget ask because we have not been notified funding has been cut, but there are reasons to believe that funding may be cut going forward. These are at risk. What I did not include in this were grants that had been extended. So these were 5 grants that in September of 2025 received a 12-month extension. We were notified Tuesday that they've all since been cut. So 4 months after they received a 12-month extension, we were notified that these grants had been terminated. I appreciate the team that has been working tirelessly for the past 2 days to understanding the impact of these cuts. And we were notified this morning that the terminations had all been rescinded and the grants continue. So this is another activity where we've spent a tremendous amount of effort to remain in place. Despite all this uncertainty in policy and activity and resources, I've been telling my staff our mission and vision remain the same. We continue to work to protect and promote the physical, behavioral, and environmental health of the people of Hawaii, and we remain persistent in that despite all those changes. The most important part for us to be able to do this is our staff. We are grateful for the authority the legislature gave us in Act 291 for this hiring pilot, which has been quite successful. We hired 38 candidates under this, average of 95 days from when the position is posted to when the person starts. And that's much more quickly than we've been able to do. It is not perfect. Sometimes because we receive and review all applications, we find some people are not qualified at the end. So there's some waste in this program. And sometimes we just go through a pool of candidates and don't make any selections. So we continue to work to see how we can improve this process, but it's showing success. To the right is a chart that looks at our vacancy rate. We have 3,551 positions, of which 2,611 are filled. That is our overall vacancy rate of 29.7%. And you can see that varies by administration, and because most of our positions are civil service, that's a CS, and I carved out the exempt positions separately. Okay. With those changes, for us to be effective, we really need to have trust. So people are wondering, how are we countering misinformation, disinformation from the federal government? People are going to believe who they trust. While we continue to put out information that we believe is trustworthy, we need to earn that trust. Part of that is done through community engagement. We had additional training for folks to be more knowledgeable about how to do effective community engagement. We've increased our communications through, we're doing a website cleanup and increase our social media activity. In a state of nearly 1.5 million people, we have 15,000 subscribers to our Instagram account. We're not getting as much reach as I would like. So I respectfully request all legislators to follow us on social media, be able to amplify our messaging. We would be grateful for that. Okay. We have lots of data. Try to be transparent. These are just existing dashboards for the public to be able to access it. We need to work on making them more easily to find on our website, but we have lots of information available to the public. Transparency is really important to build that trust in what we do. Okay. Just going over just a couple of highlights, just going to call it kind of one for administration. This is for your reference. The intent is to highlight the breadth of what we do as a department. So one of the key things we did for administration was consolidating our review and tracking of travel, UIP requests, converting from sunshine law and compliance. So it has been a priority to improve our level of compliance, and that's been consolidated and seems to be working pretty well. Okay, for behavioral health, just going to highlight, that's a graphic of the opioid settlement funds. So again, that is available to the public, how much money we've received, how much we've distributed, the projects we've been distributed on is all publicly available. One of them is the distribution of 40,000 naloxone kits, which is used in the case of an overdose to reverse an overdose. So that's one thing to protect the public. Okay. For environmental health, just want to highlight the emphasis on food safety and security. The testing, 130 food samples, going to Whole Foods and testing for pesticides. So that's an increased effort that we've been done and very successful in improving and increasing our food safety and security activities. Okay. For public health, just highlight a couple things because the legislature had supported us by giving us 2 positions to restore our oral health program. Again, not having fluoridated water, these dental screenings and dental sealant program, this outreach is even more important. So there were services, dental sealant services provided at 34 elementary schools across the state. We also have awarded that $3.5 million in contracts that you gave us last year to support and increase access to family planning and reproductive health services throughout the state. Not a highlight, but I'd like to just note 2 Kalapapa patients passed away this past year. There are 5 who are still living, 3 who reside full-time at Kalapapa. I'm feeling that it is of increased urgency that there's an approved plan so that then there is time to make preparations based on that plan. So I just want to emphasize that. Okay.
But there still needs to be better coordination, right? Because we have not been presented a statewide plan. Because it's not just DOH, there's DLNR, DHHL. There's no clear state position.
So we did introduce a bill last year. We're hoping it will be reintroduced again this year, which outlines sort of the jurisdictional changes for Palo Alto County.
Timeline.
It was supposed to be.
So within that,
This is not my thing.
Yeah.
would you like me to?
There's a working group.
No, I think it should be some joint committee between health, DLNR and Hawaiian
Yeah.
to have a more robust discussion.
Yeah, that bill
Tim.
isn't referred to me, so I don't.
Tim,
Joint committee.
Yes.
so if you,
I'm with that.
yeah, because then we,
Bill wasn't referred to me.
yeah, we've been asking for something for like several years.
Yeah.
Because we're not clear as to how we have to budget our exit strategy or our long-term strategy. And there's facilities that we probably should try to maintain and restore. There's probably remediation that we have to pay for. DHHL still not sure if they're gonna do homesteading there. I'm not sure what DLNR's overall plan is. So there's quite a bit. You don't want to repeat the same thing we have done in the past with sugar and pineapple, where we just let all the flumes go to just disappear, or they just fall apart, and then now you don't have water systems in place, and you just don't want to. It's barely being held together now. You just hate to see it fall apart.
And so we would be happy to provide information at a subsequent hearing.
So does your bill include all of the partners that actually should be looking at and overseeing and stewarding this area?
So
the
it
time-
primarily addresses the jurisdictional issues that DOH's mission is we're there to care for patients. If there's no longer patients there,
You almost have the easy part.
we do.
Yeah. So once you're,
It's the landowner.
once the last patient,
So it is how the landowners intend to use their land after their existing either lease or cooperative agreement with the National Park Service.
yeah.
So
So is there an end date for you to oversee? That's in the
and the
current
bill
law.
is after the last patient passes, it would then trigger
Yeah.
the transition of the jurisdiction. What we've heard from the community, people have different.
No, but what does the
preferences.
law say? Does
It
that
was,
as
it was to
soon as
reconnect that, it was to make Maui County whole again.
no, but what I mean by that is what does the law infer that as soon as the last patient moves on, you're
You
out?
Exit.
Then next
A
day,
year later,
1
we
year
have a year transition.
to slowly move all your operations out.
And so you're responsible for all of the caretaking of the land until 1 year after the last patient exits?
Well, currently it's in partnership with the National Park Service. So the parks, we've gradually been transitioning responsibilities to the National Park
Yeah,
Service.
see, that's what's scary, right? It's like it's 3 different agencies having their
That's
own
true.
MOAs with the National Park Service versus having a state position negotiating. And this is what we said several years ago.
Yep.
So I don't know if we have to legislate a state position, but there has to be somebody. And you're not the best person to have the long-term relationship with them because the law doesn't allow you a long-term position.
Yes.
Yeah, so, it's also a separate, excuse me, a separate county. And I've wondered about
No,
that.
that's what he's saying. So at 1 year, within 1 year after the last patient,
goes to the
that county's gone.
But
He's
that-
no longer
Does it
oversees.
disappear under the law?
Well, what we are proposing is a change to the law.
Okay.
What is the future of Kalawao County?
No, but I thought you said the current law says 1 year.
No, that was in the bill.
Oh,
That's
okay.
it.
I'm asking what's the current
Oh,
law?
the current law is It's unclear, it's open.
Yeah, so it could mean
It's
the next day you're out.
Oh, it could be interpreted that way,
And it
potentially.
could be after the last patient, because right now
No, it
they
has
only
to.
have one patient, right?
No, that's what the law is.
But the law still has Colorado County,
No,
Department of Health still has jurisdiction over Colorado County, so I don't believe that would change.
So is there an end date in the current law?
No. Not that I'm aware of.
That, okay, so the county is permanent as the
Yeah.
current law stands.
Yes.
So the last time we visit there, since we visit there, we understand the transition of the homes, right? You gotta go to the different landowners. Whatever you guys are doing to preserve it, what are you guys doing to preserve it? Because when we was there, Senator De La Cruz and Senator Lynn said, all the time she was in the House till now, she never ever heard you guys ask for any funding to keep preserving whatever's there. So basically, not just you, but previous to you, that you guys, they've been just letting it
Isn't there some funding?
decapitated, just fall in apart, and nobody's doing anything, nobody asking for money to fix it. I understand you're gonna give it to the forestry guys, but again, we have houses and buildings there that should be preserved and historically preserved.
Except they're not the landowner. So that's where, that has to be figured out because they have really almost a management role. But they don't own the land. It's the peninsula split between DHHL and DLNR. So that when the last patient is no longer there, the way how I read the law is
Yeah.
they can exit, which means it's left to DLNR and DHHL. So I don't know what their plans are because they're the landowner.
That will be fun.
There's anything that we can do to have.
No,
the-
last year there was some budget requests that we funded in the roof, the
Diligent, yeah.
landfill that we,
Yeah,
that, you know,
Requested for
They do.
the properties that you're describing.
yeah.
Those requests have not.
yeah,
Thank you.
the awkward part is, it's not gonna be their facility
That's the
after the,
problem.
yeah, so that's where it has, we don't have a better strategy to move forward. I'm not saying we're gonna exit, it's still
Yeah.
state land. But Department of Health would not have no role really.
Because it's under the national park system.
No,
No,
they don't own it.
DHL.
They don't own it. It's a
DHL.
partnership.
Yeah.
The peninsula is owned by the state.
Yeah, I understand that.
Yeah.
And their contract is only for the healthcare portion.
Well, the law is only for them. Yeah.
That's right.
Yeah, he's the mayor of Colorado.
Yeah.
Right now. With no taxing power. But according to Senator Kanuha, that bill is still alive. You just gotta get Chris Todd to hear it.
Oh, I guess the house.
Yeah, the House. So it wasn't deferred, it's not dead. You just gotta get Ben to hear it.
So that bill includes the other partners in that bill, jurisdiction wise.
So it
So
defines their
it
jurisdiction.
really affects primarily our jurisdiction for the administration of Colorado County and the status of Colorado
Yeah,
County.
But the hard part is
the-
we should pass the bill so that there is a state MOA
Yeah.
with US Fish and Wildlife or
Yeah.
National Park Service, not three departments having their own MOAs.
Should also do it possible so that they will sit around for 2 years trying to figure out who has jurisdiction.
Well, that's, and what we've been asking the last, 3 years
Yeah.
of how the three departments are going to work together. And my understanding is they have a working group, but it's not at the level where the three directors are talking to each other. It's all staff related.
No, we actually do all talk, and I think the.
Okay, then you should have a plan then.
The,
What do you talk about?
so DLNR has a cooperative agreement, right, that goes into what year we have? 2040. Okay,
And their agreement is with whom?
it is between the landowner of DLNR and the National Park Service, okay? Department of Fine Homelands has a lease with the National Park Service through 2034. So, and I think if there's a break in that lease, like there are terms that are very disadvantaged to ending that lease. So those agreements are in place, right, for about 10 or 15 more years. That's the timeline for the landowners to decide what comes after.
So the
No, but-
DHL contract, lease is that the cemetery then?
No, it's half the
No.
peninsula. Half the peninsula is owned by DLNR, half of the peninsula is DHHL. So whatever path of the wherever the graveyard is, I think it's DHHL's.
That's what I
half.
thought, because it came out as a.
No, but right now DHHL does no management of the peninsula. It's all Department of Health. So that's where really what the agreement should be is how do we transition DOH out so that DHHL and DLNR can start managing the peninsula? Because then that's what's missing. So they're all going directly they're missing that step, but they're going directly to National Park Service, when that should have been after we've agreed internally what we're going to do.
That's kind of confusing because of the cemetery. So are you guys involved with cemetery stuff?
So for what we would consider where the Kalapapa settlement is located today is on DHHL land.
Okay.
When we've gone to where it was originally located
It
on
was
the
DLNR land.
on the windward side, that is DLNR land. There's a cemetery.
If everybody came on the site visits, they would know. That's why it's so important to come to the site visits.
Well, the reason I ask that is that if the responsibility for you to do burials and all that kind of stuff, then what happens after? But I don't know if we want to give it to any of our.
No, but-
tickets.
yeah, but
But
The
that's
law,
a big
the law doesn't
responsibility.
say, oh, DOH leaves after the last patient, but they still keep the cemetery. It just says they leave.
Good.
But we still got-
Responsibility.
Yeah, but the other landowners haven't come in to say, if we want to protect the cemetery, we need X money. So that's what I'm saying is that there's a big hookah as to who's gonna do what.
That's because of the exit dates. That's because of. the
No, that's
dates
because of
involved.
us.
Yeah.
The state is
Yeah.
not talking to
Moving.
each other. The three agencies have to come up with a stronger MOA.
But your.
Talking
bill-
is not enough.
But your bill that you have that's already existing, does it cover some of that?
No, we
discussions
just
that we're
discussed
having now?
this. It only discusses them leaving.
Yeah.
Yeah, yeah.
I just wanna,
Then we gotta bring it up to the agencies, another thing, or something of discussion future.
Okay, I hear an echo.
Let's give.
No, but the thing
Okay, you
again-
can continue.
Getting to our budget. So what I have here is what was appropriated in fiscal year 26, what was appropriated for 27 in the biennium budget, and the percent increase from 26 to 27. And then the right-hand column is what we're asking for in our supplemental. That's the total dollar amount. And then those columns are the percent increase I did from 26 to the supplemental ask, and then what was already in the base to our supplemental ask. So when we look at our budget compared to what's already in the budget, right, from what was passed last year for the biennium, we are asking for $16.2 million increase in A funds, 38 million increase in special funds, and 110 million increase in revolving funds. You will see in our supplemental compared to 26.
No, but can you refer to table 6 and just kind of,
Yeah, I will. Oh, yep.
oh, no, but so this table and that table, how are you reconciling it?
I'll go through in detail.
Okay.
Okay, I'll move on. We have 4 general fund requests, and this is the order. I just consolidated the 2 state hospitals together. So we have 4 general fund requests. So in table 6, these are the top 4 items, and I'll go through each of these. So we can go through in table 6. So the first one that is funded is our priority number 2. This is for emergency medical services. We're in the budget asking, let's see, the supplemental increase was $8 million in the governor's budget. Right, that's a
Wait, and let me see.
these aren't right. That should be priority 1 up there.
Yeah, it starts with
6.
Yeah.
department-wide priority starts with 2.
So for the $8 million that we're asking for in HCH 730, as we've looked more closely on what we truly need for next fiscal year, the reason for the ask
Is
is
that right? Is that the right number or no?
$8 million is what is being asked for 730. That is what's in the governor's budget. Okay.
But you said you're looking at the
Yes.
numbers
So as
and
we looked through it, we found that we converted from cost-based budgeting or cost-based contracting to budget contracting to be more predictable and stable in our funding. When we made that conversion, we ended up having to shift from a calendar year cycle to a September to August cycle. We had to move it up 3 months, okay? So that's a cycle we're on now. Within that contract, because these contracts include services for paramedics and EMTs, and the counties have public employees, we follow the collective bargaining agreement increases, mostly BU 10, also BU 9, and we have to add that to our contracts
So the new amount is,
for the new amount each year. Okay, so that amount where we have not kept up with the adjustments, we only need $4.5 million to be whole to continue services through August of 27. We need that $4.5 million to be added to our base to get us whole to include the CBA increases.
so 4.5, not 8.
So we're decreasing our ask from 8 to 4.5.
Okay.
Okay, but I'm going to ask for it back, respectfully. Okay, so this is to cover those CBA increases that have occurred those past couple of years. It will be recurring in our base to keep it whole. Going forward, we are estimating CBA increase percentages and putting in that budget to keep us more consistent prospectively. This will catch us up. Okay, shifting to behavioral health. This is the Behavioral Health Crisis Center in Eveleigh, just real quick. You can see how the utilization has increased since it's opened in March of 24. It has connected over 2,000 individuals with services, including placement in clean and sober homes, residential substance abuse treatment, homeless shelter, stabilization beds, and otherwise connected with services. There's still about a third of patients who are seen there who either refuse or aren't connected with services. But with this patient population, basically about 2/3 of them getting connected, we consider to be very successful for how this program goes. We are looking at ways how we can address the most challenging patients, that third, many of whom have frequent visits. So we're doing better, but just want to show you that the investment in this program is working very well.
Okay, well, what is the numbers though? You're saying the beds and all of this, but when we went over there, and then again, I'm not being prejudiced to any foreigners, but when we went over there, none of those people that was getting the medical help was from Hawaii. Every single one of them was told to me was not from Hawaii. So again, we're investing, yes, we're investing, but are we investing the dollars in the right area? Because we're putting the money to help these guys get off the streets and get some of them goes there revolving over and over, getting the treatment. So again, they're not transitioning to anywhere else. They're just going back to the street. And when they get sick or they get a staph infection, they end up back in your facility. But it's a revolving door. So the statistics and the numbers that I want to see is the success rates of them not reoccurring going back over there into the facility, because it's costing the taxpayers money. So where is after they go there, or are they going to a medical facility, home, or are they going to a daycare or a hospital? Where are they going from there?
Yeah.
Because that's a lot of money we're spending for people investing that, again, have no vested interest in our tax-paying brackets for Hawaii residents.
So in this chart, it is hard to see. I apologize for the small font. That bottom left hand indicates where they go. So about a third of folks, yes, they do revolve and have frequent visits. For about 2/3 of folks, do get placed and connected with services through that facility, and that describes where they go. So as I mentioned, they'll go. We have over 500 placed in stabilization beds. 250 are placed in homeless shelters. So we do connect them with placement.
I understand that, but see, again, what we don't have is the data on the process. Now, you send them to a homeless shelter. How long do they stay there till they go back on the street? See what I mean? So you guys let go of the services because you guys don't track it. But what I'm saying is, once they go to the shelter, after they wear out the time at the shelter, guess where they go? They don't go to homes. They go back to the street, and this process starts all over again.
I don't know if that's the right question for them,
Oh.
because once it's in the shelter, that's really going back to DHS. So yesterday when
They
we,
gotta share the data too. I mean, they gotta share.
well, that's what we were
something.
saying yesterday. They don't have data.
They don't
So
have
that's why we want the reorganization of DHS so that we
Yeah.
can collect data.
OHHS, not all of the.
Yeah.
Yeah, yeah.
Yeah. Yeah.
Yeah,
So
well,
the
I don't-
homeless,
Homeless and housing
Yes,
solution.
please.
yeah.
Thank you. Yeah, sorry.
Okay.
Okay. All right, the state hospital. There are two general fund asks for the state hospital. The BHCC, Behavioral Health Crisis Center, is one of the programs that we can, it's preferable if we can identify, respond, care for patients while they're outpatients and reduce the need of them having to be admitted to the state hospital. The BHCC is one of those ways. And we are working with HPD, and rather than arresting people, if they can take people to the BHCC, then we keep them in that system and connect them to outpatient services. But patients, people do get arrested. They do come to the state hospital. So we've been working very hard to decompress the state hospital. On the left are some of the activities that we have done. We have discharged patients to community hospitals to put them in psychiatric beds. We've been working that if people are in neighbor islands and would be transported or transferred to Hawaii to be admitted, if we can keep them admitted on their neighbor island where they're near their supports or their family. So that is one of the things that we've been doing. You gave us the authority to be able to discharge patients directly to a long-term care facility. And we've been utilizing that. I believe we've discharged about 15 patients into a long-term care facility. We want to get patients in the most appropriate setting, which tend to be less expensive than keeping them in the state hospital. That top right graphic just shows what the census has been for 23 through 2025. We are licensed for 292 beds. I believe the peak was about 391. Through the decompression efforts, we've gotten as low as 358, but we see it's just starting to come up. That bottom right graphic is again over that same period of time, but this is a snapshot of patients admitted at that time. What's the offense that they committed? And what we're seeing is the distribution is shifting, that there's an increase in felony C of patients admitted to the hospital for felony C. When we looked more closely, we're not seeing there's an increase in admissions of people for felony C. It's that their length of stay is getting longer. So that's why they're contributing to a higher proportion of the census. So we're trying to really use these data and dig in more deeply to understand the root cause, to see how we can better address these issues going on. So even though we've had that decompression, the census is coming back up. So more patients are coming or staying longer. And there's also a desire to create capacity for civil admissions. So whereas we thought we would not need as much funding, such as for overtime, as the census goes up, we're still going to need that additional funding, but for contracted beds. So you gave us $5.5 million last year to contract for beds. And one of our asks is to continue that $5.5 million, such as to contract with nursing facilities or these other hospitals that are caring for patients to keep them out of the state hospital. So that's the $5.5 million. And then when the increased census, we're looking for the $2.5 million for overtime, which is what's in the budget. So this just shows what the average census was for fiscal year 2022 through 2025. And it also shows what we've been paying, what we've been budgeted in our payroll and what we've spent and the variance. As the census has gone up, we've had a negative variance because we've had to use overtime to care for the increased number of patients at the state hospital. When we got into 2025, our shortfall was about $6.5 million. This is when you saw, again, a significant increase beginning in 24 of patients. We are working to hire folks. So when we look at what the actual is spent, it is both for filled positions and overtime. In 2026, we're projecting this year a $10.3 million shortfall, but this includes $3.7 million of THP that we fronted. If you account for that, we're still at about $6.5 million of payroll shortfall due to the need for overtime. And as we are projecting for 27, it's down a little bit, but we're still projecting over $6 million of a budget shortfall.
So, you know, when we had the informational briefing, I remember Dr. Matson saying that the governor had tasked you folks to reduce the number of patients by half. And you're telling me you folks have not been successful in that?
So we were tasked to reduce by 100 patients and we have reduced it by 47. Okay, however, patients are coming in faster.
Than you folks are able to. Okay, the other question is, prior to every session, you folks know this because that's my pet project, is to try to relieve the overcrowding of HSH. I ask you folks, what is the primary reason for the population growth? And usually it's at 704. So each year I come up with 704 bills to try to reduce, to try to lower the amount of the evaluation so you guys can process them and get them out. You folks, now you're telling me you haven't figured out how much, I mean, why we have the census, I mean, increase or?
So
I mean, I'm more than willing to submit more bills, but I don't know how much on the 704 we can do other than.
is it 704 the Act 26 folks, same thing? So there, I'll start and then Dr. Mazur. So the highest volume of admissions are the 704s.
Still is.
Is the highest volume of admissions. It is the most effort because of the frequent churn of admissions and discharging. So they take the most transition type work because they are
So
the greatest volume because their length of stay is so short.
Okay, I just want to make sure that the committee knows what 704 is. It's when they basically, as soon as they get arrested and their defense attorney says they are unfit to proceed, so they can't go any further. So we are asking the state hospital, originally it required like 3 examiners to determine whether or not they're fit to proceed. That's why you guys see me producing bills to try to reduce it down to 1 because they couldn't find the 3. Okay, so now, and I've also tried to task them with trying to, like the class C, make it non-violent ones to get those, even though they're class C felonies, to get them down to 1 examiner. So whenever you guys see me asking for like 1 examiner, it's not to try to get them released because as soon as they get evaluated and they're determined fit to proceed, they're supposed to go back to jail. And then they proceed, okay? And that relieves Hawai'i State Hospital. So right now, Hawai'i State Hospital, according to them, it's mostly, we haven't figured out whether or not they're insane, and we haven't quite figured out whether or not they're fit to proceed, so we can put them back into the system. That's what I mean by 704, and that's why, do we have any more compression requests to try to bring those population down? And they're talking about like 75%. Is like 704.
Wait, this wants to.
So the it's a 704, 421. So these are the folks with petty misdemeanors. And so that's why it's the length of stay. It's very short. They come in because they need to have fitness evaluation.
So these are like the homeless people who like defecate in the streets, who like cause problems and stuff like that. And that's also why we try to do law enforcement diversion so that the cops go, hopefully start diverting them before they get into the system. Because as soon as the judges see them, they automatically go to state hospital. We want the cops to be able to like send them directly to like Evil A. And so whenever you start seeing those law enforcement diversions, that's the reason, because I don't want them to go to state hospital.
Oh, there's no room.
That's
Right.
exactly
Right. And we're working with others in terms of trying to find other ways to.
Tried to expand service facilities, but that failed last year. So we got to come up with another plan.
Yeah, and we got to work with the prosecutors right now because they're not in agreement. They want them to go through the system, and as soon as the judge comes in, the law is they automatically go to state hospital for evaluation. Okay, and we don't have room.
How much long care patients you guys have that is in there more than a year or so? How much of patients you guys have like that?
So I would say the ones who are on the short term, not Act 26, but the ones on a 704, 421, the ones coming in with the petty misdemeanor charges, they stay for about 7 to 10 days. So that's the shorter length. But they're the ones who come in frequently. So that's why we have a high admission rate, because a lot of those folks come in, but they don't stay very long. That's why on the felony Cs you see there, if you look at our population, just one day, you'll see a lot of those with a felony C, and that's because they're not necessarily coming in frequently, but they stay for a very long time because we're trying to get them fit to proceed.
Keep coming out here, right? Asking us.
So that's the thing, then, if you don't like go to court, whatever, you just hopefully the justice be insane, right?
Yeah.
Okay. I see what you're saying.
So,
Yeah.
so basically, I just wanted to let and Brandon knows this as chair of PSM. We're also trying to get DCR because they're asking for behavioral health beds in their facilities to hold on to some of the 704 patients. We haven't been successful in that, so, but we're still trying to talk. And I guess now it's gonna be Carol Fukunaga I need to talk to.
I
Question.
think there's probably a disconnect between the city and state when it comes to 704 patients, because a lot of the 704 patients, as we consider them, the police or whoever, they don't know who they are. There's no record of them. And so I think there's steps that happen that before they get the treatment that makes them, it's longer, it lasts longer.
Sometimes they know, it's like the repeat offenders, they know.
Right,
keeps-
but I'm saying the new ones or
Oh,
the
yeah.
ones that could have been helped earlier, there's a disconnect, and I don't know what to do to.
Yeah, but
fix
this
that.
involves more than just DOE.
And I think the reason why Dr. Fink put the slide about the BHCC, the Behavioral Health Crisis Center, is that is one way where we're trying to work closely with HPD, law enforcement, to bring folks to that facility so that we can do the assessment there rather than, getting them into the
Yeah.
the court
No,
system.
we had
and
one
commit-
pilot, right, the IHS triage to kind of help, but we never expanded it.
But we have to
was the
get the
detail.
police and the prosecutor to agree that.
No, but what if we added a position for you and changed the law, instead of having 3, we actually have someone, a state employee that actually does do that determination.
Every time, I'm just gonna let you know, every time I try to get it down from 3 down to 1, judiciary comes in and fights it, and that's where I end up losing my.
No, but I'm not saying one. Well, it can be one, but it should be a designated doctor within the state hospital that can determine that quickly, and then we move on.
Oh, we have that already. State examiner, DOH state examiner is already one of the examiners. And so we try to.
So one,
Okay, hire
Good idea.
2 more doctors, and then we got 3.
would be that when we do our assessments for fitness, to also to include recommendations on whether or not the client would be appropriate for inpatient or outpatient, and send that, then the judge can use that information and determine where they would want to court order the person.
Before they're sent to the hospital.
Yeah. So they would be under the custody of the Director of Health, but it doesn't necessarily mean they have to go to the state hospital, but I would say that majority of them are sent to the state hospital. And
Yeah,
they
but
might
there's
not
no room
need
there.
to,
That's-
right, and they probably
That's
don't
right.
need, and,
Yeah.
Yeah.
Okay.
inpatient level
And
care.
that's why they keep asking us for money.
Okay, how long are we gonna?
Oh, I just
Yes,
wanted to
Lawrence,
bring up
go
the
ahead.
reason why we're having this influx. The reason why we're having the influx is because the people that is, again, we don't want the data, which we already harped on that. IHS, they don't share anything, and when they go examine him, they take too long to process them, and then HPD picks them up, take them to jail, and they end up in the hospital. So the guys that we are hiring and contracting to go out there and do the job, they need to do their job. And they're not. And that's the problem. Why are you guys getting influxes? The majority of the influx is houseless people, right? They're in downtown, they're in the communities, they're going to a point that they reach a certain level. Where was the meet and greet from IHS before they reached that level? No more. And how come we don't want? Because we don't want the data. Are we giving them big money, millions? But they're not, and it's not you guys. They're not doing their job. So that's the reason why they're going where you guys stay, because they're not doing their job. If they do the job, we take all the grants away. And if they don't give us the statistics,
Okay, what is the question?
that's the question, right? Question would be, we need to have these agencies do their job so they don't end up in a
Yeah,
state
but these
hospital.
guys don't control the IHS contract. It's
Yeah.
going to be DHS.
The department yesterday.
Oh,
So that's why we had the meeting yesterday. That's why we're talking about the reorg.
yeah.
So they're related, but you need the DHS reorg
So how
in
can-
in that particular section of
so how can we make one bill to?
no, so
expedite that?
yeah, so that's what we talked about yesterday.
Yes.
The department is now going to work with the chair to develop a bill so we can reorg that component.
But it would help if we also have the data from HBD, how many incidents they have the same people over and over, same issue.
Doesn't matter. Doesn't matter because there's no room in the facility.
Yeah.
So no matter at this point, no matter how much data we have, there's no room in the hospital. So what we got to figure out are alternatives so that
There's
we
no
can.
referral to this hospital.
So it's the data is one component, but that's still not going to stop the overflow of too many patients going there that they cannot accommodate. Okay, we should probably move on and then
So
you
we
guys
are
can take care of this in
specifically
subject matter.
requesting, 5.5 million, which was again, what was appropriated last year for contracted beds. And what is currently in the budget is $2.5 million for our payroll shortfall. And we're asking that 3.5, we're going to give up for EMS to fast forward back here.
Okay, and the hospital is fully utilized now because I know at one point there were sections that were not open and not you.
Oh yeah, what happened to that lawsuit? You guys getting your money back? You should ask AG for that.
Okay,
I mean,
okay, next.
Talk offline. Okay, all right. And then the last general fund ask was for HH 720. It is for a criminal background check. OCA, Office of Healthcare Assurance, responsible again for licensing healthcare facilities, but also for background checks. There's a number of requirements of Medicare and Medicaid for certain providers, particularly long-term care. These are the requirements of a background check. The cost is passed on to the employer of this requirement for background checks. The intent is to help protect vulnerable patients, to not put people in positions of employment with direct patient access who might take advantage of those patients. There are other programs because most of these, other than that initial FBI check, are state databases. eCrim, we can do electronic exchanges with. Some of those other databases we cannot. There's this thing called a RAP program, which would be ideal, which we could do just real-time automated checks. And in theory, as other states have done, not actually charge our healthcare providers. At this time, we've been beta testing. We just need this $121,000 to finalize development of the background check system for those providers who are required to do background checks. This will help them track
okay.
their folks. It'll
What
be
about-
easier for providers.
What about the 30 million before that?
The 30 minutes. Oh, all right. Well, okay. Sorry. I just went through the general funds first, and I'll get to special funds. Sorry,
Okay.
it's a lot of work. But last one is not in our budget. As you may have heard, we are in the process of
The
finalizing
5.5.
leases for 2 spaces
5.5.
to relocate Keno Holly staff. This is not currently not in the budget. We did not. We are executing leases this week, and we now have learned the cost is $3 million for these leases per year, and these will hold, as you can see there, about 550 staff.
Yeah.
Okay.
Well, this is my worst fear because if we're going to end up leasing, this is going with the amount of even just a couple of years, we could have just bought the new building,
Mhm.
and that's why we tried to do the Hawaii Loa campus, but then Castle Foundation added these restrictions, which now prevent DOH from going there. And now DLNR was like, "Oh, good! If they're not going to take it, we'll take it." So we really gotta figure out a long-term solution because this is gonna cost us more in the long run.
Cause even like the Evil Lake property, right, we lease, from the city, doing the rail, when the rail stuff come through, we're gonna lose the lease and we'll spend hundreds of thousands in the
If
renovation.
nobody's gonna help you, I'll try to find a building in Wahiwa or Mililani. If nobody here is willing to help, then I'll help you.
Big Island, Big Island.
Because how much you gotta make, that's your CIP request.
There's a Hawaii building in
Yeah.
Hilo.
Hilo.
That,
Senator, I
Oh,
like.
not that
Yeah.
easy. We try, is that the same one about the county that we tried to fix?
DLNR,
Oh, was it DLNR?
it's DLNR, it was a.
We had
not
explored it.
lease.
We had explored it.
Yeah, it
It
was
was
an,
it was a little bit of cost prohibitive.
yeah.
Okay, these are the remaining requests. These are all special fund requests. These should be in the.
They're all like, I'm not driving to Wahiwa. You guys are cute.
They don't want to like Hilo either.
Okay.
Okay,
Okay, this is just a little bit of vaccination data. It's for the 24-25 school year. So it was in the fall of 24 before the current federal administration took office. And while the vaccination rate increased, ticked up a little bit from the previous year, the trend is down on vaccination rate. Exemption rate is up. This kind of coupled with the messaging coming from the federal government, right? We've just seen a decrease in vaccination rates. Concurrently, we've seen an increase in vaccine-preventable diseases. There was just this one case of mumps and 2 cases of measles, and we were frankly lucky that we did not see more community spread. We have seen wastewater testing that's been positive for measles,
ooh,
but there have not been other reported cases. It could be that cases are out there and they weren't diagnosed or reported. It could be there was a traveler who really was slightly contagious, but still was shedding virus that got in the wastewater. We don't have great explanations. I just want to highlight that it's a concern. This is just a incidence of pertussis cases, and you can see it's increased almost 3-fold compared to the previous year. So this continues to be a real threat. From a finance perspective, there was one systematic review that was done that estimated the cost of investigating, let's say, a measles case was over $40,000 per case of investigation. So if we have an impact, there's a real fiscal impact in addition to a health impact.
okay, but this is B funds, right? That's
Yeah. So as a result of everything going on, just to mention that we joined the West Coast Health Alliance. So we've joined these other 3 states to provide, scientifically based information, having vital information if you're interested. But specifically to the B fund ask. So Act 175 that was passed last year established the immunization purchasing program. And is modeled on the Vaccine for Children program to make it easier for providers to have vaccine in their office, be able to administer to their patients. When we looked at what we spent on the Vaccine for Children program, which is federally funded, we spent about $21 million, and that program covers about half the kids in the state. So when we looked at calculating what our special fund would be, we don't expect everybody to cross over to the purchasing program right away. Provided we can continue to purchase through the CDC. So we are requesting a ceiling of $30 million of special funds. Act 175 allows us to collect the money from the health plans to cover the cost of purchasing vaccine, but we need the authority to spend that money to do the actual purchase. That this ceiling would allow us to actually purchase the vaccine, okay? Because we can purchase it at a best available pricing, which is less expensive than the plans. Then the plans actually save money. It's better for everybody. DBC, we're requesting an increase to the ceiling of $5 million. That chart shows the balance of revenue and expenditures over the past couple of years. That red line is the current ceiling. And you can see with the projected expenditure, it would approach, if not exceed, the ceiling. There are new activities that are desired for use of these funds, particularly to respond to the auditor's findings with increased compliance activities and potentially exploring increasing redemption sites. So requesting an increase of $5 million to that ceiling.
Senator Hashimoto.
So what, actually, so over the Christmas break, I went to go recycle some cans just to go see what the experience was like.
And that's not the only time he recycles.
No, no, plenty, right? At $21, which is, added up, it's plenty can. But I was like, at the end, I was just like, if to make people worth it, it wasn't worth the trouble. So I think you have to figure out how to make it more convenient, and you had to go pack it all up, had to go drive, right? And I think coupled with the administration problems, we have so much money in this fund. I don't know what the problem is of, like, we got to think through a lot of this stuff of what are the new technologies that we're using. I know we had a whole hearing on it, but I think part of it is, I think, is 5 million really enough? You have what, 60 million, I think, looking in your chart over there. Yeah, so you have a lot of money, but the point is how do we push the redemptions up, right? Because I think at the end of the day, people are gonna be like, okay, I'm just gonna throw it away because it's not worth my time.
Yep.
Well, I hope you don't throw it away. You throw it in your blue bin or recycling. But yes, we recognize that there is an issue with redemption. We recognize, and also nationwide redemption rates are lower. We do recognize that there is a need to create perhaps more redemption centers, as we spoke about in the informational briefing. A site on in Kailua was had to close because of a leasing issue. We're talking to the counties about increasing space for redemption. We're also looking at perhaps approaching other agencies who may have properties that they could lease to the department, and then we can maybe increase rates that way. So we're exploring all options.
Yeah, but Kat, if you just use your money to buy property,
Yeah, so one of the issues, I understand that one of the issues is, everyone thinks that we have a lot of money in the.
where you cannot leave, like if you did a statewide plan
Yes.
where you don't have a state agency with land that you can use or a private, why not just purchase something?
Right.
You can lease it to Department of Health.
We could do that, but we run the risk of, if the redemption rates go higher, then we have to pay everybody their nickels that which we have this fund that is recycled. I see that the teeth are mashing, but there is that possibility, and that if it happens, then we would just have to come in
That's fine.
for appropriation.
That's
So-
fine, because then if you buy a property, like in urban Honolulu, and you put the redemption center at the bottom, and then above the redemption center is your new Department of Health building.
We'll explore that. Thank you.
Well, but you must know how much is old money that came in, right? That will probably never be deposited. Do you know what that number is?
I'm gonna call upon Lene, who is the acting branch manager.
That's the reason we have the informational briefing.
No, I listened to it. Yeah, no,
I
we're
really
trying to
don't.
tease this out now, right? What is the
They
action?
have like broad-ish.
May I ask you to repeat that question, please?
No, I think what is the amount that will never be redeemed? And so it's like then you can take that money and then you can do some of these broader program improvements, right? Because I think it's at a certain point, the program has been around so long, like you probably got collections, I don't know, 10 years ago that hasn't been redeemed, right? And you're going to be like, okay, is it ever going to get redeemed? Probably not.
So if you take a look at our FY27 requests, our anticipated expenditures, we are looking at that difference to improve on our programs, and it exceeds our revenues. So we are
No, I'm not talking about revenues. I'm talking about over time, you should know how much you don't really need to put in reserves, right? That's not going to be redeemed.
So prior to COVID, our redemption rate was about 60+%.
That's over 5 years ago.
Yes, and it has decreased since then.
Yeah.
And so that's where we're trying to recoup and with the expenditures in FY27 to improve the program, such as.
Right, no, but what I'm saying is probably, okay, let's say 10 years ago,
Uh-huh.
you got a redemption of maybe 60% of the funds, the 40%, right, left, you're probably not going to get redeemed. So you can carry that over and do something to pay for something, right? To increase recycling or
Okay.
get innovative, right?
So-
We don't have
so
that
in
calculation.
addition to reimbursing the deposits, the nickels, we do pay a handling fee to the recyclers. That additional handling fee.
Yeah, that should be
is-
baked in though into that. You should know
Well,
that,
actually,
right?
we only collect 6 cents per container that's sold in the state. Our handling fee is much more than that penny container fee. So we have the 5%.
Okay,
plus the
we get that. So of the, I don't know, because according to Senator San Buenaventura, she said there's 80 million. I don't know how much is in there.
What is it, 89?
Yeah.
What is your expected redemption
It keeps growing. Every year it keeps
Yeah,
growing.
of that money? So what is it that we need to have redemption plus handling that we actually need, right? Because then the rest is just all free money
Yes,
for us to
our-
do other things. We don't know that number.
So our expenditures have been about 600 million in the last year. Or I would say in the,
600 million? 600,000?
60. I'm sorry,
60?
60 million, about 54 for FY 25, it was about 54 million.
54 millions, and then you have still 89, so you,
Give you a little idea of, at the end of last
These guys
last
are the-
calendar year, we have about
he's not
74
correct.
million in cash balance.
Right.
5 million of that is currently encumbered. We need additional 2 million for the rest of this fiscal year for expenditures. Moving into FY 27, we do have, we require that additional balance to
Yeah, so you gotta.
provide encumbrances to contract the redemption center operations into the next fiscal year. So yes, there has been a carryover of funds from year to year.
You just
And
do
that's
something.
part of which we are looking at doing improvements in FY 27, which
so why is the balance so high though? Are you just not are you just not spending down the encumbrance?
well, our 55 million encumbrances, majority of that is with the redemption centers. That's the nickels that are anticipated for payout.
Yeah,
That's
but
what
then you're
the
actually,
handling
so you're
fee is.
encumbering it, but you're not actually spending it.
Not all of it, but the difficulty is.
But
when
so why are you
contract-
encumbering 100% when you know redemption is 60?
No, we're not encumbering 100%.
What are you encumbering then?
Off the top of my head, I don't know what the percentage is.
Okay, well, I think we just need better data. Like or I think the point is you just gotta figure out what is the true balance. Like I don't know if you got that, tease that out. I don't in the last hearing, but I would imagine we need that information.
Yeah, and they also need an auditing ability to,
Just do it.
well, that's another,
Yeah, we do have an audit, we do have auditing ability, but we're entering into as a result of the auditor's review of our program, we are entering into an audit RFP for auditing. So that's part of the money that we're asking for so that we can enter into that contract. I recognize that there seems to be a large sum that's still left in the fund, and that I also recognize that the redemption rates are lower. We will look at all options, including perhaps purchasing properties, so that we can increase redemption and make it much more easier for the consumer.
You're spending the entire amount up to your ceiling now.
Close to. Next year we will be close.
Yeah, so how much?
So
But you
we're-
have much more, you have a lot more than what your ceiling is.
Yes,
From
we
past
do.
years, yes,
Yeah.
they do.
but we're looking at spending with the auditors, proposals or
But they
contracts.
need to
We're-
audit.
No, what we can do is in the budget, just put a line item, redemption centers, and we'll use, instead of geo bond, we use special fund. So it comes out of your special fund. Because you have that money, you're not doing anything with it.
Yeah.
And I feel like unless we do something like that, you're not gonna take a risk. You guys are just gonna kind of keep reviewing and planning and reviewing and planning. So
And building up.
we gotta do something.
Yeah.
And then we can just do an audit. We can just ask the state auditor to audit.
No, they don't want to do the audit. Yeah, they don't want to do the audit. I guess the audit of the department they're willing to do. they don't like the idea of, the auditor does not want to do the Department of Health's job of auditing the redemption centers, which they haven't done.
No, that's fine, but what we can do is add a position to auditor, but fund the position from the special fund. And then they contract that money to go and just do what they're supposed, have the
Do what they're
auditor
gonna-
contract and see if they're not gonna do it.
Right now, we have an RFP that is under final review from our procurement office to do just that.
Okay.
So again, follow-up question. So I've had calls by many of the stores and so forth questioning the audit you guys have put on them for their recycling. Where is that at? In other words, you guys wanting to have them do an audit that running them some $10,000. I mean, the impact to these small mom and pops. What's the deal with that?
There's a state law that requires independent third-party audits
Of the redemption centers.
by
No,
the distributors.
Of the distributors or the stores and the bars and
Yes,
stuff.
of the distributors. And so we heard from the small businesses, and therefore the administration had issued an executive order to essentially stay the enforcement of that for the year.
Yeah, that was like super impactful.
Yeah, so we are looking at long-term solutions for that.
Right now, nothing, I mean, they're not being forced to have to do the auditing internally for businesses.
For this year.
Okay,
Chair.
so are you guys going, so after this year, you guys might visit that again?
There's a bill. Well, it's a state law, that's why.
Yeah.
So yeah, we're looking at long-term options.
Would you guys use some of the recycling money to help offset costs if they're being forced to? Or do we
that
need
would
to
be-
write a bill to have you use the funding to help offset?
That would
costs?
require, I think, a bill.
They just, yeah, that's what I mean. Okay, no, thank you, Chair.
Albert has a bill that.
So you better
is
hurry up
not-
and spend it on redemption centers instead. If you gotta figure out what your priority is, because there's not, if everyone keeps adding all these things to require, there's only so much money, so you better spend the money on the priority. If not, that's gonna all be their general fund requests.
Chair, since we're on that topic, have you folks created any kind of checks and balances with reportings? Because I think, yeah, the state auditor is kind of tired of auditing you folks. Because right now it just seems to be going by honor system for these distribution centers that are returning this or reporting this. So instead of kind of continuing this cycle of insanity, auditing, are you guys internally structuring anything that would have any kind of direct checks and balances?
So part of the auditor's recommendations was to conduct risk-based audits of the redemption centers as well as distributors. And so the RFP that we're preparing now to go out is for that auditing service. So that's one aspect of it. In addition to that, we are looking at our payment procedures to see if we can do something different to help with that gap.
When are you folks looking to launch that?
The evaluation, we're doing the evaluation now.
Okay, thank you. Thank you, Chair.
Okay, next.
Okay, next, the next two are revolving funds. So this one is for the drinking water revolving loan fund. These funds are used for both public and private water systems. In the past year, distributed over $57 million for projects. I believe you folks are very familiar with this for this one and the next one. Because there's additional funding through, I think, the BIL and requires a lower state match. We're not requesting any state appropriation, just raising the ceiling for us to expend more federal funds through these programs. And this is the other water pollution control revolving fund, and about $93 million was expended last year in projects. There was a pilot of $2 million on Hawai'i to support cesspool conversions, also investing in recycled water systems. So it's a, our municipalities are benefiting from this federal funding that we're able to distribute. Okay. There is one laboratory in the state that can do cannabis testing. And there are requirements of our current medical cannabis program to ensure that the product is safe and not contaminated. There's a need to have some redundancy should there be a disruption on that lab, and then also to have a reference lab for validation purposes, not just to ensure is a quality assurance for patients who are participating in the medical cannabis program, but also as we're looking to increase enforcement activities of illicit distribution of intoxicating substances. A reference lab would help be able to do that testing for enforcement purposes.
Okay, so my understanding, and Vice Chair, maybe you could help us on this. We made this request during conference. There was a blank because we wanted Department of Health, OCCR, to be more diligent about getting all of those cannabis, from the retailers. Okay, and so there was a request for a lab, and my understanding was Department of Transportation has the monies for the lab. So why can't you folks use the Department of Transportation's lab? Because they need to do cannabis testing too.
I'll start. My understanding is, right, but they're testing human specimens. That's correct, particularly for the blood alcohol and other for human specimen for intoxicated drivers. This is a partnership with the proposed partnership with the College of Pharmacy in Hilo. So it's also to support that capacity locally within our state system and in Hilo for this, cannabis reference testing. So it serves a different purpose. The Department of Transportation, as I understand, does have a contract with a private lab to do testing. And this would be, again, not testing human specimens, but more substances that the College of Pharmacy would be able to do.
Okay.
So just to follow on that, what are you doing in terms of coordinating? Because there's a number of labs involved. So DOT is trying to develop the drug testing. Also, I understand that the JABSOM or the Cancer Center, I don't know which of the two, also has a lab that they're testing. And you folks are testing. So what are you doing to coordinate so that it's not duplicating? If in fact you're doing something differently, then we should know who's doing what.
I'm not sure if there's a little bit of confusion. The lab that we're looking at is testing products specifically. I think DOT is probably more interested in testing the levels in a human specimen. And so our testing really is about product testing that comes off after
stuff
manufacturing.
from the retailers to determine the amount of THC. Remember, we had those problems before.
Or from the farms directly. now.
Right. And so right now, the lab that currently exists does all the testing, but we need a reference lab that's going to also monitor whether their testing is accurate. So when they finish their testing, it goes to the retailer, then the retailer puts it on the shelves. We then need to go back and make sure that the labeling that, for example, this is one example, the labeling that's on the shelf actually matches what the label originally put on there when it was originally tested. And it can be used for law enforcement. So if law enforcement seizes products and they want to know whether it's above
But
the.
it's not with taking blood and
No,
check.
no.
Versus the DOT one is you're taking blood or spit
my
and then trying
understanding.
to figure out if they have the substance in their system.
So
Yes.
who's going and pulling out the products and for you to
First they
test?
need the lab.
We don't have that
Oh, you don't have
capacity right
We
now.
need them, they need them.
Okay, next.
So real quick, so as of today, you guys still fall under federal of,
Wait, can you keep the question toward the budget amount though?
okay, no, but that's going to lead to the budget amount. Because when you look at that, the registry under a legal cannabis that's being sold, based on your criteria of testing, there's only one legal one that is on the books today. Literally one legal strain that is on the book. So I kind of taken aback by you guys testing.
No, so they would test the product to see
Yeah,
if
yeah.
that whatever,
No.
whatever
Like-
they grab is legal
Yeah.
or not after it's tested.
Yeah, but at the federal standard level, there's only one legal that has been rightfully cleared by FDA and patented, which is what happened at the conference. So, while we're testing all this, it still doesn't,
That's strange.
yeah, no, I know that, but.
Yeah, but we're not, this is
so we
state
said-
law.
Yeah, so basically, we good with whatever is out there then, based on you guys.
No, we're not. That's the reason we
Yeah.
need the lab.
No, but that's what I'm saying. So today, there's only one legal that meets that strains of being tested that has been cleared by FDA. Which is why I'm asking why run the test if there's only one that has passed the 10-year levels of patented.
Okay,
and
no matter,
clearance.
the lab determines
But
if the
they
product
don't
is legal or not.
Something else. Okay.
Yeah.
Yeah, but.
Because then this testing would be void.
No. I think you guys talking apples and oranges. I think she's talking about, the medical, the one that's the FDA approved
Yeah.
one. But then we have a different, the dispensary, we have a different law that allows for
Medical
beyond
cannabis.
that, medical cannabis. And that's what they gotta test, is within state law.
So we're going to do a separation between state and federal law.
We have
first.
been,
It has
Yeah.
been for.
that's what's been the case all these
over
years.
10 years.
No, by just looking at it, because then if that's the case, then if say,
Then we'll go
Clear.
revise it
Yeah.
if Trump
Okay.
decides to deregulate, right?
no
That's
matter
up
what
to
he
descheduler.
decides, I mean, we still get state home rule. I'm just saying
They
that
stick
Yeah,
in-
yeah,
at the
yeah.
testing level and the safety measure, right?
No, I mean, if it's a nationally approved product, then FDA or, some federal agency would do the test. This is state approved law, products that are approved by the state law, that they have to test to make sure that it meets the qualifications of the state law.
So meeting the qualifications and the clearance comes from the Department of Health. If somebody dies from it, does the state assume that liability as well?
No, for the same reason we don't assume the liability when somebody overdoses on alcohol and,
So just check.
no, we're not doing.
I just like be sure, because there's a lot of shit out there.
Okay, next,
Well, that's the reason they want the lab.
next.
Okay. Okay, I believe this is the last one of, special funds. For vital records, this is probably the place where we interact the most with the public. And I've said this in the past where we've received the most complaints from legislators. I'm pleased that those complaints have decreased. There's been a significant amount of effort by the staff, reduce the backlog by 5 to 7 months of certificate processing. But it still is a very cumbersome process with an antiquated system of multiple disjointed databases.
Okay, so you need the Form 69 to fix it.
So to modernize the system is $5 million. We have $1 million in federal funds. We really need $4 million to do this. We understand general funds are really not available. So because there is the Vital Statistics Improvement Special Fund, we're looking to raise the ceiling to be able to use the special fund money to implement the system in phases. It would take longer and likely cost more overall.
Which department priority is this?
This
Yeah, maybe because you can go over because you're going by a different list than we are. So we're going,
HC 90 overall. So it was
No.
department priority
3.
3.
okay, the 1.5. No, that's the program ID priority.
760.
It's on table 6.
90.
Yeah,
That's why it's HC 90.
is that the second item?
It is the department-wide priority 90.
Oh, 90.
It's on the-
Okay. Then you said 3. Okay, yeah, so that says refunds of 469,000.
They increased the special fund ceiling from the current balance of over 500,000 to a total ceiling of $1 million.
Okay,
Part of that is the legislature reallocated how we expect how we dole out our fees that we get in Act 148.
Yeah.
So previously we had got $1, now we get $7, and so it increased our special fund. And so we want to be able to use that special fund money to finance the new system.
yeah. Okay, next.
Chair, sorry, I have a question with
The
regards to that
system,
record.
yeah.
Yeah, so So specifically with the special funds, sorry, two questions actually. Number one, what do you think is driving the need for more certificates? Because you folks had increased from 2023, about 172,000 certificates to now 2025, 300,000 certificates. So I'm just curious, what is your department suspecting could be an increase of these requests?
I suspect it's real ID. So everyone who needed to get their star on the driver's license, they all had to come in and get birth certificate. Kind of thing.
Okay, makes sense. And then my last question is this program really going to help you guys to expedite the process even faster? Is it a vacancy thing? Because 5 to 7 months of backlog, I would think it would need more
You're automating,
hands-on.
right?
We're automating it. So right now we have 5 different legacy systems. For someone to fulfill an order, they have to go to multiple systems to pull
Yeah,
the information.
that's true.
out. It's a little crazy. So this is going to compile everything into one system. Somebody goes online, puts in an order, same system, we can pull it down and get it out.
And once the program is up and running, how long from the time they order it to the time they get it?
Well, right now for birth certificates, it's almost instantaneous. We've caught up. So if you put in an online order today, you're gonna get it in the next couple days.
Oh, nice.
Yeah.
Okay.
So we're maybe 2 months, up to 2 months behind on death certificates, and we're trying to catch up. But it's very difficult. We have to put a lot of manpower in that
Yeah.
just to keep up.
Yeah.
Thank you.
With the new system, it's gonna be much better.
Thank you.
Okay,
I'm
next.
gonna hold you to that. We still getting complaints as to how late you guys are.
Okay, just transitioning to our CIP requests. Speaking of Kalapapa, there are underground storage tanks. There are some federal regulations that by 2028, we would have to like do a double wall or other kinds of monitoring of the tanks rather than investing in that money because the tanks would have to be removed by 2045 because they're within 100 yards of the coastline. Just want to remove the tanks. So this is the money to remove the underground storage tanks at Kalapapa. The second one, we've been exploring the need to renovate the state lab. So this is an ask to be able to do that.
No, but some of this you already got, right? You're only going over fiscal year 27.
Yeah.
Only going over the new ask.
Yeah. Yeah. If you got it, no, you already got it.
I don't think we have that.
No, but why is it under fiscal year
27.
26?
Yeah. Some of it you got.
This is the second year of the biennium.
27.
Yes, but we don't know with the USTs, we didn't have, there were insufficient funds to have Diana.
So this is actually for the.
You need to come up.
Yeah.
You need.
Thank you. The UST ask is for the actual construction phase of the process.
Yeah, I know.
So
I'm just wondering, why is it in fiscal year 26 versus 27?
it should be in 27.
Okay.
It was not given last year.
Okay, so this ask is for the supplemental year.
These are all supplemental asks.
Correct.
Okay, so almost everything should be all 27 then. Because you have both fiscal years, if you look.
Yeah.
Table 15.
Well, the table I think is a little confusing. It starts with what was already appropriated. If you go to the bottom of it, it has the new ask.
Okay.
Chair.
From
Wait,
which
So what
Okay.
part of it did you do for Kalapapa, for example? We gave you funds for the synthetic cover and we gave you funds for the roof. So
No,
is that done?
That's for the landfills. That's in process.
Okay, so it's done. So you're asked, the additional amount is what?
Different. No, it's table 15. So if you look, I think what they're going down, it starts with number 9. Program ID Health 100, department-wide priority 9.
So you're only
It's only
asking
for
for the
removal.
storage tank removal. That's it, not.
For this year.
Yeah.
Yes.
2027.
Question on this page, thank you, Chair. For the ones for the Waimano Home Road campus, is that roof replacement for where the state lab is, or is that the other building?
It's the other building.
Okay, and then could you provide a breakdown of what your phase 1 renovation is for that, if you don't mind?
This for that.
This is for 10 and 11.
Yeah, 10 and 11, sorry.
Electrical
Is it how they are?
switches.
No, department-wide 10 and
9.4.
11.
And you're 1.
Yes.
10 and 11, priority 10, 11 on table 15.
Yeah, right. So the Waimano Poly complex is for electrical switches. It's concerns with the electrical system. They're cracking concrete walls with now water infiltration that risk causing further damage. So the general repairs, what we're calling the health and safety improvements.
Is that building is where your clean air and clean water branches are, or no?
It's
Oh,
below
I got it.
below the guard shack.
Okay, but at some point, none of this includes a roof replacement for where your state lab is, right?
The state lab wouldn't know, but Hawai'i is.
Yes, okay, thank you, Chair.
Okay, why don't we just go on to 12 since we discussed 10 and 11?
The health and safety improvements for the health centers, this is to fund planning design to replace the roof of our health centers or health centers.
Okay, and then number 13.
That's the Haleola roof.
Yes, that's a clean air, clean water building.
And then 14 is
I think it's the BNF ad for the
$2 million.
$2 million for just deferred maintenance statewide.
So there's 57 facilities just on Oahu that we have to maintain. And so that money is to do little fixes all over.
The funding for the state hospital, is that going to be reimbursed, or is this new, is this part of the problem with the building that's under litigation, or is this other? This
The
is,
2 million. The 2 million is not for the state hospital.
they're starting at number 9. This was already given to them. So from number 9 down, this was already Powell. This is in the budget.
this is 27.
They're starting, this is, I know, but it's done. It's starting from them. If you look at that, what they're asking for, they confused us by adding the whole biennium. They were only supposed to add the supplemental requests. So no need to, you guys already gave the first half, because
Yeah.
that year is Powell.
That's just by 27.
Highlight from.
Yeah. Okay,
So these are our new supplemental requests.
yeah, so starting from
Yeah.
our list number 9 down, that's what's new. Everything is already appropriated. Okay. Okay, any last questions? Because we have HHSC outside.
I just have one more question on contract costs,
Yeah,
table
go ahead.
14, just one question. I think you might know where I'm going with this. Table 14, this is page 22 of 44. Your Catholic Charities contract. This is for community-based residential 2 sexually reactive youth services statewide. Is that the contract for the property in IAL?
Yes.
Okay, and then that contract is, how I read it here is, that's a 6-year contract. Okay, thank you.
Yes.
Thank you, Chair.
Okay, we're gonna recess for 5 minutes so that HHSC can set up. And then at 1 o'clock, we have Department of Transportation.
Yeah, there's one more group.
We recess. Okay, reconvening. So next, we're going to hear from HHSC on their supplemental budget requests. Good afternoon.
Good afternoon, Chair Dela Cruz, and Vice Chair Moriwaki, we just walked in, and members of the committee, and as Chair Ventura as well of the Senate Health Committee.
You just have one request.
We just have one request, yes. So I just want to introduce myself. I'm Edward Chu, if you guys have seen me before, but I'm the President and CEO of HHSC. And with me here representatives from all of our regions. Clayton McGann, our CEO for West Hawaii region, Dan Brinkman from East Hawaii region CEO, Sean Sanada from the new CEO for Oahu region. And we also have Stephen Nawahine for Kauku Medical Center, our CEO there, and Christina Sato and Kurt Akamine from Kauai region. So I'll give you the Reader's Digest version of our narrative testimony.
No, we read it.
You read it?
Okay, let's go straight to table 6.
Okay. So the first request is for Kahuku Medical Center. It is a general fund request for about $1.4 million is what the governor recommended over what they had already been appropriated in the biennium budget. So, Stephen, you want to come up and talk about that?
No, we
request?
can just, does anybody have questions on that item? Okay. Do you have any CIP requests?
Yes, there are CIP requests. I believe it's at table 15, if I'm not mistaken.
Does anybody, you have
Yeah, I
questions
have
on?
questions,
Okay, go ahead.
yeah. I have questions for Kahuku.
The 612,000.
The 612,000, but you also on table 16, which is a lapse, you're lapsing that amount and you're asking for, I don't quite understand what your request is for the mammogram. And then you're,
Oh,
on a
did
lapse.
you get cash?
Yeah, so I can help explain that one. So,
Yeah.
The lump sum for Google Medical Center, which you see about 650,000, I believe that's what you're referring to. So
That was a fund.
that was eight funds that were appropriated back in 2022 and 2023.
Yeah, so the
They
governor-
requested us to, if the projects weren't already at a substantial completion
Yeah.
point, to let those funds lapse as general funds, and then the governor would put in money as C funds
Yeah.
for the supplemental
No,
budget.
but this
and
is
stuff.
where I was saying during the Senate retreat, where the governor typically had said, if they don't want to pay for CIP out of cash.
Yeah.
And so this was cash for that.
Right.
They were asked to lapse the cash, which means now they don't have the money to build it. So now it's in the governor's budget as GO bond request.
Right.
So they never
So-
spent the cash
But-
Yes.
and it got absorbed in carryover.
So, but for 211, the medical center, what I see is that you had altogether, for fiscal 23, you had 2 million in CIP, 3 million in cash.
No, wait, which one are you talking about?
Yeah, where are you?
No, but it's an A fund.
Yeah, no, but before.
in
they
table
had
6?
Previously in 2023, 2024, they had appropriation. But I just want to know, what is the status of those projects? Because you had previous appropriations, yeah, for
In the previous biennium.
in fiscal year 23 for the medical center projects lump sum. And then you're lapsing 650, but you got 6 million. And then for the lump sum, though that's Oahu region, so for Kahuku. So what were the projects and did you complete the projects? And so the balance is 650 that you're lapsing?
No,
Huh?
no. They had previous CIP's monies,
Yeah.
so separate that question first. Did you did you
But
spend the
did you-
CIP monies that you had in the last
Okay.
biennium?
Yes.
Okay, and what were they spent
Yeah.
on?
Come up here and explain.
Morning, Chair, Vice Chair, committee members. My name is Matt Mamas, the COO of Koku Medical Center. So all the previous CIP, so that's still in progress.
Yeah,
So-
and therefore what?
I'm sorry?
What are they for?
So we have ADA bathrooms. So currently we have no ADA bathrooms at Koku Medical Center. So we're creating ADA bathrooms. We're remodeling all of our patient rooms.
Yeah.
And we're remodeling our nurses station. So no funding will lapse. So everything is in process, right?
Yeah.
As we speak today.
Yeah, that's from the last biennium.
Correct.
Yeah.
Yeah.
So
correct.
this biennium, last year they got cash. That's the 650.
650.
They were gonna spend it and the governor's office said, no, don't spend cash, lapse the cash and we'll reappropriate 650 CIP. So they never spent this
Correct.
because they were directed, don't spend the cash.
Correct.
Yes,
Correct.
so you're exactly right. So
So
we had
650 is all you need then?
No,
for
they-
completion.
Yeah, yeah,
So
yeah.
That's correct. Yes.
No,
The
612.
So we have
612.
So we have $612,000 for a mammal program that was shut down about a year ago. And that 650 is what the governor asked to kind of put off until next fiscal year. Then we'd get reinstated that funding. That's for the 650.
So, and this 612 is for the mammogram?
That's correct. Yes.
So
That's
this
the
is the
program.
replacement money.
No,
Instead
it's
of
it's supplemental funding. The
No.
I'm sorry.
Instead of the 650,
Oh, yes,
this
yes, yes.
replaces the 650 cash.
Yes, that's
Yeah.
correct.
It's 15 on the 16.
Okay. Okay, any other questions on the rest of the CIP? You have any questions? No.
No.
Okay, adjourn.
Okay.
That's it. Calling to order the Joint Committee on Ways and Means and Transportation. So this afternoon, we're going to be hearing from our Department of Transportation, who will provide their supplemental budget requests. So good afternoon.
Thank you. Aloha Chair De La Cruz, Chair Inoue, and members of the committees. Ed Sniffen with the Hawaii Department of Transportation. With me today, we have our senior staff here. Our First Deputy, Tammy Lee, Airports Deputy, Kurt Otoguro, our Highways Deputy, Robin Shishiro, and our Harbors Deputy, Dre Khalili. And also with us, our boss, Melissa Miranda Johnson, our Special Assistant. Really appreciate this opportunity to present our supplemental budget. For us on the DOT side, we see our goal and our job as ensuring that we assist in ensuring that every department reaches their priorities. So you'll always see us involved in energy and food security, education and economy, and housing and homelessness to make sure that we can share the resources that we have to ensure that everybody can be successful. On our side, one of the biggest things that we know we can do is increase the amount of funding that we have in the state. So we've been working really hard on all three of the modes to ensure that we can bring in more federal funds. On the airport side, we brought in about 155 million since the time of IIJ came through an IRA. On the highway side, it's 260 million in August redistribution, another 160 million in grant funding that just comes directly to the state, and another 160 million on top of that that goes to the counties. So we made sure that we could maximize the type of funding that we get through. On the harbor side, who doesn't have a federal nexus on funding and really never got grants before, we brought in about $100 million. So we could maximize the amount of funding in the total that's available for us to do good things for our state. With that, on the airport side, we were able to pave out about 6 million square feet of runways and taxiways. As everybody knows, the biggest way that we can improve safety is ensure that our planes take off and land safely. And the best way to improve our on-time delivery is to ensure that our runways are clear of any debris so planes don't have to be delayed by them. We pushed forward significantly on that. In our terminals, I hope you guys have seen the adjustments that we've made, not only to the level of maintenance that we have in those areas, but also of cleanliness. Our staff have been working really hard to ensure that the experience that everybody gets through those airports are significantly improved. And the information that we share with the community has been increased tremendously. You'll see online the number of parking stalls that are available for you in different areas. You can see online up on the boards the wait times that you have through checkpoints, and we keep adding those in through those areas to ensure that everybody is well informed on what kind of timeframes they'll have to get through those portions. On the highway side, we had 150 million lane miles paved. Huge for us because for two reasons. One, we got to make sure we fulfill our federal mandates on the level of maintenance of our systems. But two, I'm sure anytime you guys go to your community meetings, the first thing they ask you is when you go fix my road. So we're trying to push.
Half mile, they never fix it.
I think yours is next on the list.
She's gonna hold you to it.
On top of that, we want to make sure that the system is ready for all users. So we're not just focusing on vehicle usage on our system. We're making sure that we can connect people to the goods, services, and opportunities through all uses, bike, pedestrian, and transit, as well as vehicles on our system. And you'll see the significant improvements as you go forward. I'm sure none of you can drive any day without hitting some kind of lane closure. And I say it with a lot of pride. Our staff moved forward pretty quickly to ensure that we secured funding from the federal government and made sure that we could put that funding into the ground as fast as possible. On the harbor side, significant improvements in the way we approach our projects. In the past, we would just do maintenance in different areas and try to look for the one big project. Our harbors group had moved forward on the digital twin, a modeling system that allowed us to visually look at the opportunities we would have to repair the system proactively versus getting impacted by storms in the future. And secondarily, look at the opportunities that we can overlap with the private industry to ensure that we can maximize the use of our lands. Also moving forward to finalize KCT this year, our largest development for harbors in a long time. Once that's done, we start moving forward with improvements for our Young Brothers and Matson to ensure that we upgrade Honolulu Harbor significantly. And last on the administration side, we got to make sure that we have the right people and technologies to do the work. Since 2023, when we are up about 20% vacancies, we've been working really hard to fill them. We're down at 14.9 now. We're pretty proud of that. Making sure that we can bring the right people in to do good work. We're also moving forward on a lot of AI pieces in our systems to ensure that we get our first filter done by something other than our manual staff. And from there, we can use our staff's technology and their thought processes to ensure that we can refine the messaging, refine the approaches, and do things a lot more efficiently, a lot better. Tammy's been working with the modal divisions to ensure that we're upgrading our technologies throughout. That's my pitch to you on what we're trying to get done, and I'm happy to move forward with the tables if you're ready.
Okay, yeah, we can go table 6.
Excuse me, can we just ask a couple of questions with regards to the administration?
No, let's just get through the table because they only have 3 items.
Oh, okay.
Yeah, okay.
Because you have some changes with the administration with the other 3 properties you transferred from DAGs. I'd like to know about that
Yeah,
later.
we can
No,
talk
but
about
if it's not related to the budget, then you can have it in subject matter.
Yeah.
Okay.
Awesome, thank you. So on table 6, for us, it's labeled Air 11 of 62. You have that page?
Yeah, wait, page for you, us it's page 14, but is the table 6?
Yeah, table
The
6.
first one is redescribe 3 positions.
That's correct. So in this redescription, we're making sure that we use the resources that we have. We're not trying to add any positions to our group. We're repurposing positions that we have to the needs that we have. On this piece, these are 3 positions that we're trade-off transferring for to make sure that we can take care of that.
Yep. Good afternoon, Kurt Otuguru, Deputy Director. So what you're seeing, Senator, three positions vacant. We want to repurpose them,
What
redescribe
is
them.
VIPA 2?
VIP, these are the greeters.
Oh.
Yeah, so we're taking those positions and putting them into productive things for the electrician and.
So those are not just greeters. I mean, those VIP positions, they
Yeah.
greet, but they also take care of taking care of the lines that come through. They can speak several alternate languages to ensure
Yeah.
that we get the
And you
best
depart
experience for
from
everybody.
and then directing.
Yeah, they're directing.
Exactly.
So
Trying to
it's
get
really
you on the
passionate.
bus, make sure you don't pass
Exactly.
pass the cord.
Exactly.
You gotta go through customs.
Exactly. And you know, try to go pre-check when you're not supposed to, right?
Yeah.
So how are you redescribe, it says redescribe the position. So what are you moving this from to that?
So we have those VIP positions that we know we cannot fill at this time, and that we don't need significantly at this time.
So where are you reflecting the reduction? Because you're adding in special funds 143.
It's on table
Yeah.
4.
Table 4.
No,
Table 6.
well, table 5 is reductions, but table 4 would be.
Those are governor's decisions.
Decisions?
It's gov decisions. Sorry.
So
Table 4 reflects the revenue neutral. I guess we need to put it on table 5. I think they were confused about whether or not that should just be O&M without
Okay.
in 20 and
Okay,
not
so this
in
is cost neutral.
Yeah,
cost
cost
neutral.
neutral.
Yes.
Okay. Okay, next one.
Okay, next one is the additional expenses to Conrac. We have a fire suppressant system that has PFAS in its usage,
Oh.
our fire foam.
I was wondering why it's expensive.
Yeah, so by FAA's requirements, that whole system got to be replaced. It cannot just be the tanks, cannot just be the lines, everything got to go. These lines have only been in since 2019 and 2021.
Okay, you know what? After you fix this one, can you fix the capital one too? Because Donna Kim can't stand when it interrupts our briefings.
One was only for one city, one time, only for Maui, right?
To Honolulu and Maui.
Honolulu and Maui.
Yeah.
Yes.
So expensive.
Yeah, it is.
It's the whole system.
It's the
so
whole
cannot
system.
help.
Yeah,
Wow.
exactly.
Okay, and the last one.
Last one is additional funds for special maintenance. There's repairs that we need to do at the Kahului Airport on the roof and the ceiling. There's some leaks that we want to make sure we preemptively set and reset the skylights in that area.
Mm. Okay, any questions on the additional ads? But only the first one is cost neutral, yeah?
That's correct.
And the other two is really like almost CIP,
That's correct.
but it's RN.
Special funds.
We're going
Yeah,
to
you
use
got
all
special
special
funds.
funds.
You
Yeah,
got special
special funds.
Chair.
CFC funds.
Question? Yeah, Director, just on the Conrac, the change, you talked about Maui and Oahu. What about the other airports, Big Island, Kauai? Do we have those same situation there, but we have a timeline, or what's this?
No, so those, we don't have Conracs there.
Okay.
Yeah, we're looking at
It's the rental car,
Yeah.
you know,
Yeah.
the rental car buildings.
Oh,
Only Maui and
okay.
Oahu, right?
Okay.
Sorry, I shouldn't say Conrac, the rental car.
Open air.
Yeah.
Yeah,
Open air.
No, but you don't have a rental car building.
Yeah.
yeah.
That is very true.
Okay.
Got it. Okay.
Thank you. Yeah, so that's air. Any questions on air?
No, we can go table 15 if anybody has questions. Okay, if not, go back to your question on administration.
Yes, my understanding is you took over from DAG's 3 buildings. Can you explain?
Yeah, so under DAG's management was our main building on Punchbowl, our testing labs building on Like, and our Oahu District building in Mapunapuna. So all 3 was managed by DAGs in the past. All 3 of them only have DOT in them. So we've requested and received approval to manage those buildings on our own now. So we'll take it out of the DAGs network, allow them to repurpose their resources towards the other buildings to get better service there, and allow us to run the buildings on our own.
Are we funding then with all, because, thanks, Tammy.
Director for the administration. So we took over maintenance of the building October 1st. DAGs had already had executed contracts for things like elevator, AC, landscaping. So we're going out with procurements for those, and that's why some of the asks are for that. We already paid for utilities like water, sewer, and electricity, but because that's in the journal voucher transfer between departments, it's not in the budget. And so now that we're going to be contracting for the work, that's why we're asking for that amount.
What about the maintenance? The building maintenance, who'll be doing the work, DAG's folks?
No, so the building maintenance, what we did was we asked kindly if Kurt could give us 3 positions, a janitor 2, a janitor 3, and a building maintenance worker. And so that's reflected, I think, in their papers as well as in the transfer is actually going to highways because functionally they can help with that. And so we're going to be contracting the work, but the building maintenance is going to be I'm sorry, I don't remember if it's a UPW, but I think it's a UPW position.
Oh, okay, okay. Here, Director, you also talked about the discussions with biosecurity. Can you explain?
Yes, on our side, we want to make sure that we're capitalizing on any opportunities we would have to hit the highest priorities of the state. Biosecurity definitely is
But
one.
not having any positions in the budget.
No, we don't have any.
So we cost pretty much neutral.
What we're trying to do is see how we can partner with our different agencies to maximize biosecurity. We've been working with Customs and Border Protection, who is going to be adding in biosecurity into their pieces. So we're working with them to see how we can support it in different areas.
Okay, the next question I had has to do.
Add to that, so wait,
Oh, excuse me.
No, yeah,
Just
we're-
okay. You can-
Well, we still have highways and airports.
Yeah, that's fine.
we can go back to biosecurity.
Wait, what?
Yeah, the question was, you're creating an employee engagement portal, $675,000 in 2027. And that's can you kind of explain?
Yeah, so what we wanted to
Where is
do,
that? What table is that on?
you can give the page, please.
Yep, sure.
We'll give you the page, Senator.
Oh, well, why don't we wait till we get to that
Okay.
table?
Okay.
All right.
Okay,
Oh, here, why don't you have highways,
okay.
page 133 for us?
Did you do harbors?
So we can
Not
do,
yet.
Oh,
We're
okay.
not, it's coming up.
In harbors anyhow.
Look at highways now.
Harbors.
So we can go back, but we just go ahead.
Okay, highways.
133, page 133.
33. So the first item is the photo red light imaging system, special fund. Gives us the authority, that's the 5% surcharge on that. We would be appreciative if you got rid of the 5% surcharge requirement. I'm kidding, but that's what we're putting in for that, on that piece over there.
That up as far as the discrepancy between the speed limit, the reduction of speed limit, and then the tickets that follow.
I think we're pretty well cleaned up on those pieces. So initially, you're talking about the speed portion of that piece? Yes. So when we that's why we ran the test case so long, to make sure we could take care of those idiosyncrasies in the systems. And also to make sure we could adjust the system itself, the speed limits on the system itself. We've cleared that up at all intersections now. We made sure that the speeds are fluid in those areas rather than getting to abrupt reductions.
Right, because I don't know if you folks have experienced it, because you may not have an intersection in your district, but like on Nikiliki Highway, as they're coming down, they're going 35 miles, and all of a sudden it's changes to 25, but they're still, and then so they get picked up at going 35 in a 25 mile. Okay, and so they're getting warnings and then tickets. But the other thing is they're seeing the light, and as soon as the light starts to change, they speed up. And as soon as you speed up and you go beyond the 25 miles to get to the intersection, so you're not there in the red, you're gonna get a ticket.
Yeah, so first, they shouldn't be speeding up. If they see the yellow, that's the time to slow down.
No, but I see the green, all of a sudden I'm right at the intersection and it turns yellow. So I'm not gonna just stop right there.
So as long as you're
Intersection,
going through the intersection before it turns red, you're good. So you don't have to speed up. If that speed takes you through the intersection at that speed, you're good, as long as you get through it before it turns red.
But you gotta get to it before it turns red.
Yes,
Yeah.
yes. But so you get plenty time before it turns red. So,
But those are the complaints I'm getting.
yeah.
I don't think she's talking about herself.
Yeah. I'm saying you in general.
She has a friend.
Yeah. But so,
I live on Cleve Avenue.
so we've adjusted, and everybody should understand, we're not ticketing anybody at 1 mile per hour over the speed limit. The law clearly states that it has to be 11 plus. And we'll make sure we honor that. People shouldn't be gunning through the intersection at a yellow. If they can comfortably slow down prior to then, we should. To make sure we minimize the potential for these T-bone crashes that we've been seeing. The great thing is, and I really appreciate the public's help on this, we see red light running reduced by 62% since the time that we started the red light running program, which is awesome. We're starting to see that reduction in speeds now since we've started the citation process. And I'll tell everybody to be rest assured that we're not ticketing at 11 plus right now. I'm not gonna tell you what number we at, but it's not at 11 plus. We want to make sure we target those that are dangerous to the community.
Nowadays, no.
So you are ticketing though, it's operating.
Yes, it's since the time that we,
Both the red light and the speed.
yes, since the time we started, we got 17 citations that we issued since December 5th. Is that right? Since December 5th.
How fast is the citation come after the infraction?
It's within 10 days by statute, we must send it
The
out.
warnings were like 3 months later.
Yeah, because we were trying to clean up the system when we were doing it.
And we got 500,000.
Yeah, so during that process, we had 500,000 warnings that we sent out.
And that's only in Oahu.
That's only 10 intersections in Honolulu district.
Did that cost us in post?
Nothing. So that was part of the process or part of the contract with our vendor. Yeah.
Yeah, because right now it's a pilot program right now, right? So, or
Not a pilot.
can you extend it?
Yeah, so it can be
Okay.
extended. So the law allows us to put in speed enforcement anywhere there's red light enforcement. We've tried to hold to the 10 intersections that we have right now to ensure that we could work with judiciary so we didn't blow up their systems. We've helped them automate in those areas, and they've been amazing partners. Judiciary jumped all in to ensure that they could adjust their processes to accommodate the timeframes that we were looking at. Now that we're comfortable where we are, when we expand, we'll probably do 10 at a time per year in different areas. And I think the first 10 will still be in the Honolulu district so that we can incorporate all of those fines into one area for now.
Yeah, 6 of the 10 is in Kalihi. 6 of the 10 is in the Kalihi area. So the Kalihi people really feel like they're being picked on.
They're not being picked on, the data picked on them. So the data suggested.
There's no other intersection like the Kalanana Ole or all that is not equal to the number of.
And so remember that when we first started this, it was just on red light running. So those typically, when we see red light running, it's in areas where you're just getting off a freeway or you're just getting onto it. And the Kalihi area has such a lot of junctions in those areas, especially on Nimitz. That's why it's kind of consolidated.
Going to the freeway.
Yeah.
You can bring them to Aya Pro City.
So we would love to, and we will as soon as we get everything finalized with the judiciary, so we don't overwhelm their systems.
Okay, why don't we go to the next one?
Okay.
Central services.
Yep, so those are, the first one was on the red light running. The next one is speed. And that one is also the 5% central services charge. And this is all estimated based on what we think the fines are going to be. The third one is Safe Routes to School. That's the program that's that there's a board that considers where this funding goes. That 3 million is what we anticipate will be raised by the 5% surcharge that went on to registration. sorry, $5 surcharge that went on to registration by the end of this
Page
the state
133.
fiscal year.
Here.
Yeah.
Yep.
Okay.
Next item is the repair and maintenance of motor vehicle safety office, Waimalo facility. That's the old school that's underneath the viaduct over there. Get leaking roofs that we gotta fix, and that's what the funding is for.
Even under the viaduct.
Yeah.
Leaking roof.
Yeah, it's interesting, because plenty water come down. It's made, the viaduct is made for water to go through, so we don't build up any hydrostatic pressures on the viaduct. And even under the viaduct, get water leaking through the roof. That's
Okay.
not a statement about our viaduct. It's very safe up there. Next one is the traffic signal repair and maintenance on Maui. We saw costs increase significantly for upgrades of signals. We're adding in more sensors now, so the signals are smarter, and it can help us meet the needs of the public 24/7 versus just 2 times a day.
I guess we all need sensors.
Roadside safety maintenance on Maui. As you all know, we're minimizing our use of weed killer on the system. Want to make sure we minimize that. We've already gotten rid of glyphosate on our system. We're using a non-glyphosate, I don't want to call it pesticide to ensure that we minimize any kind of intrusion into our water system and everything. And because of that, because we're minimizing the use, there's a lot more mechanical maintenance we need to do. So the cost of that is going up.
Get the ORNL.
Oh, sorry. Sorry, I skipped over maintenance, management, and operation of train on the historic ORNL right-of-way. The ORNL right-of-way is the train system that runs through the Eva side. We've never put in funding to maintain that track. And because of that, it's degrading.
But we own it.
We own it. So it was gifted to us by GSA a while ago, with the caveat that we put in a pedestrian path, and we did a bike and pedestrian path. We did that. And also that we go through federal highways anytime we need some kind of improvement on that path. That's been causing problems because everything requires a federal action when we do that. The federal action makes it more expensive and makes time a lot longer when we go through it. So we're trying to address that. And we'll do it by
Mike and
putting out an RFP. And that RFP will allow operators to bid on this contract on the type of maintenance they'll do in the system and how much we would pay them to do it. When we do it, that operator can decide first how they would maintain the system for us to fulfill our historic requirements. And second, how they would want to operate it in the future.
So will the cost be borne by the operators?
No. So there's going to be, when we start working through this RFP, we're going to be looking at what we should put into it as far as a maintenance perspective. And when they bid on it, they're going to be telling us, in order to maintain the system, this is how much it will cost you. Now, if that operator operates at a profit and they believe they can cover that maintenance of the system without the DOT putting money into it, then that means that they're probably going to win the bid. And if they do that, this cost that we're putting in right now for maintenance will probably go away. But we're hoping that this is going to work out from that perspective.
Couple of things, for the rail, how much of the tracks that we are using or is in existence actually historic?
No,
The whole system is historic.
No, the train tracks has been removed and replaced. So the one that is removed and replaced, it still doesn't fall under the historic one.
It still falls under it.
Falls under it.
Yeah.
So that was the misunderstanding.
Yeah. So anytime we touch those tracks, we got to fulfill the requirements of ECHP.
Yeah.
And those requirements allow those systems that we put in to be eligible under the historic register.
Right, because again, with the jurisdiction with the road and closing of the road, remember all of that? So the Hawaii Road, they're a nonprofit, so even if they're raising money or making money off of the property, are they gonna offset in the future? You're saying that they're gonna offset the cost of the maintenance?
So they got to bid on it. Anybody who's on that, nobody can be on that system unless we allow them to. So in the past, the difficulty that we've had with the ORNL is that we've never had a contract with anybody on that system. So we're going to reset that now. Part of the reset is going to be to ensure that the resources are available for that system to be maintained. And second, if there's profit being generated on it, the state should benefit from it.
Yeah.
So that's what's going to be captured in our RFP.
Sounds good.
Okay.
Thank you, Chair.
Okay, next.
Sorry, where am I now?
The
VNV.
Yeah.
Okay.
the
VNV Consulting Service. Maybe you just go ahead.
the next line item is IVNV. That's the independent verification for our H4 system, which is our new financial system. So there's new services that was added. So this is additional funds for them to complete that independent verification.
This one is a requirement by Federal Highways for us to upgrade our systems.
Okay, next.
Yeah.
Okay. The next one is guardrail repair on Maui. So similar to with our traffic signals, cost of guardrails have gone up. New requirements, crash standards have gone up. So that's additional funding for the district to continue that. The next one is roadside maintenance on Molokai. So again, on that one, as we stop using pesticides, more labor intensive work needed to cut the grass and so forth. So that's a new add to their budget to be able to use contracted services. Alongside with that, on Molokai is a traffic control. So on different islands, we already have traffic control contracts, flaggers and things like that, certified, people who've been trained. And that allows our maintenance folks to actually do the actual work, operating equipment and so forth, rather than having them do the traffic control. The next one, statewide stream monitoring. We partner with USGS. They have a lot of stream monitoring gauges. So this is additional funding for costs that they do in 49 of our streams. They collect a lot of flow data, especially during floods, and it helps us do our hydraulic analysis when we do any bridge projects. The next one, equipment rental on Molokai. So on that one, it's adding 76,000 to their budget. Molokai, we just sometimes need some specialized equipment, and renting is a lot more cost effective than buying the actual equipment, and it doesn't sit. So that's added to their budget and allow them to do that. Similar to Maui, guardrail Molokai also going up. So it's adding another 50,000 to their budget to do replacements and repairs.
I should add on these pieces, when guardrail get damaged, if there's a police report or something that identifies the person who damaged it, we'll bill them for it. But a lot of these, we don't get police reports for, we don't identify the person who actually damaged the system. Sorry.
Yep, no, good point. The next item is the actual operating cost for the photo red light running system. So that's to give us the authority to go and spend, the citations that are collected for that program. And parallel to that is the automated speed enforcement. So, both of them, they utilize the same equipment, same camera system. So it's just split between the two different automated speed or automated enforcement programs we have.
The money from the fines go where again?
It goes to a special fund specifically for the photo enforcement system.
If the money gets much.
We're not going to get too much.
Start giving all the tickets.
Okay, mine.
You should admit.
The next item, civil identification program. So that's increasing cost for the labor. The counties do the state IDs and the driver license. So it's just increase collective bargaining for their labor. The next one is the Safe Routes to School 5% surcharge again. That's the anticipated revenue that will be coming in and the 5% required. The next one is the mobile driver license program. So right now we have it with Apple, and I think the first year was about $20,000, and there's an annual cost. So besides Apple, then we'll soon be adding Android/Google, and so those two will have an annual cost to be able to utilize that electronic identification cards. The next two items are with our road user charge program. We rolled it out last July for the rental EVs, and we got a grant that will allow us to look as we expand the program to all light duty vehicles.
Yeah, it's a $6 million grant from the federal government.
Yep. So the first line item is the state match. The second one is just for fiscal year 27, the amount of federal funds that will be used. And the next two items is for a pavement management system. Again, it's a local match with federal funding. So a pavement management system, every year we scan our roads and we collect data on the cracks and just the pavement conditions, and we put it into a pavement management system program that helps us prioritize statewide, and that way funds, we can utilize it and prioritize statewide, not just by district necessarily.
I have a question on contract costs.
For highways.
For highways.
Okay, you know what? Why don't we go through all the ad tables, and then we can go into all kind of questions on the other tables.
Okay.
So any questions on table 15, which is page 164? It's the CIP for highways. Okay, if not, let's go into the, and we can always go back. We can, if you can go to page, wait, where's Harper's? Page 74.
Is this for Harvard's table
Yeah,
six?
Table 6 for Harper's.
Yeah. You go.
So for harbors, we have two requests for additions. One is $9 million to establish an electronic data interchange system, which will help not only manage data about cargo that moves through our ports, but it's a system that we could share access to other state agencies that would need to do law enforcement or even for biosecurity purposes.
Yeah, so this system, this $9 million system, could help us track everything that comes through, prioritize risk to ensure that we can start focusing those of our limited resources for enforcement on areas of high risk. I mean, that's the whole intent, to start optimizing for biosecurity. Just from the DOT's perspective, this is going to be benefiting way more than just the DOT. So we'd love to consider if A funds could be supplemented in this request.
And then the second addition is for $75,000. For our Kalailoa port operations, we're seeing an uptick in expenses, in part because there is added activity. So just in the last fiscal year, we're seeing a 53% increase in fuel volume moving through the port. More activity means more security. So some of these costs will cover that. But also a lot of the expenses there are for water, where a vessel is going to take on water from the port, and then the Board of Water Supply is increasing their water rates. So this is to accommodate increasing costs.
I want to go back to what you're doing with the biosecurity, what you're doing at the harbors. Is that's all electronic, right? And you're keeping data on that?
So right now it's manual and it's an honor system.
Yeah.
So the EDI will basically take every carrier's electronic documents and it can create reports that can be automated rather than, because right now, while we have the authority to inspect a manifest, it would have to be done manually. And the manifests are like
You
this.
inspect every cargo that comes?
No,
in?
no. So this is just for us to flag so we know what is moving through, what types of commodities and in what volumes. Right now, we're just tracking the number of containers and then we collect a fee for each container.
The information from.
It would be from the carriers.
So the carriers have to have a manifest. They don't have to provide it to us. Or when they provide it to us, we don't have the resources to go through them all right now. Once we get this EDI system in place, it'll AI it for us. It'll be our first filter on identifying those highest risks, whether it be by cargo type or location or source or person who's receiving.
But they have to, all your carriers have to provide that information
yeah,
to you.
yeah.
It's just manual now.
Yeah.
Correct.
Okay, why don't we go to page 234?
Is that admin?
Yeah,
Same
admin.
table. Same table. Same table.
It's table 6, but it's on page 234.
Yep.
Admin.
Yeah, him.
Okay, so the first ad is the employee engagement portal for 675,000.
Right.
So Senator, that is, we did a bunch of all staff meetings and we found that, within our communities of employees, we do a pretty good job at like letting them know what our upcoming projects are, what our plans are. But we think, having something that is more engaging, and it would be to do climate surveys on how they're enjoying their work, other things like any kind of controversial plans, say like a roundabout in their community, we can push out information and they can comment, they can take it back to their communities and socialize it, at parties. We're not saying to advocate for, what we have planned, but just to be familiar with it so that they can speak it to their communities with it.
One of the concerns we found from our workers is we did a really good job of getting information out to the public. And a lot of times they're hearing about our initiatives from the media versus from us. So we wanted to make sure we had a platform that allowed us to share information with them first, get feedback in from the people who are actually on the ground, not only doing the work, but living in the communities. We get that feed in and we get better products as we push them out. And we get people who can answer questions when they get to their family parties. This system, we started off with the 675 looking at this because that's to build out a system. Tammy looked at another option of a software that we already have now to see if that alternative would be better for us and be a lot cheaper. So this is the top line.
That it's gonna cost you the recurring funds of 125,000.
That's correct. And that's basically for the maintenance and the hosting and also any kind of upgrades in the future that we might want to make.
Okay, next item.
So the next item is 300,000 to expand on our internship program and our workforce development program. This past summer, we hosted about 120 interns. This would cover the cost for laptops. We had site visits to Honolulu Harbor, H3 tunnels, and the Daniel K. Inouye International Airport. And we provided the opportunity for the students to travel to see these on site as well from Hawaii Island, Maui, and Kauai.
Yeah, we offered them to come to the Senate hearing and present, but they didn't want to.
You did a
Okay.
good job. That was
Were you folks able to hire any of those interns?
7 of them.
Yes,
Nice.
Yeah,
currently
yeah.
we hired 7
I
and
think the
counting.
Honolulu Harbor 100th anniversary, that one of the
Yes.
projects that the students had.
Very good point. One of the improvements that came out of that, when we started prepping for Honolulu Harbor, our student interns developed it for us, the program for us.
Yes.
So how do you do the enrollment?
We have an application that we post on our website. Whenever we go to job or career fairs, we have the QR code.
Oh, okay.
And if
Yes.
okay, we'd love to send you the text of that so you can share it out with your communities as well and email as well.
That's important.
Okay.
Okay, let's go to page 146. Senator Elefante can ask his question on athletics.
Oh, yes. On page 41, under highways, table 14, under contracts, this is freeway service patrol.
Highways.
Yes. Your freeway service patrol doesn't cover like H3 or other highways, right? It's
So
just
for us,
only-
that's 149.
that's only certain types in that contract, is that correct?
Yeah, it covers H1. Covers most of H1, H201, and part of H2.
How can we expand that so it covers other highways?
Yeah, actually, we were talking about that, and we can just there's a new contract going to be starting this July, so we can look at it and add more funding and stuff.
Thank you, Chair.
Table 12.
Of which
Okay.
division? Harbors, highways, airports, or general admin?
General admin,
Okay, so we gotta go back.
the appropriate time.
No, we can, that would be page, you're looking at which table?
Table 12, general administration.
The other
1746.
positions? Is
Yeah, okay. My question is, you have a few homeless coordinator positions. What are you finding on the ground when you get there that it's necessary that we hire permanent
'Cause
full-time positions for this
Yeah.
homeless?
Yeah, so we appreciate the funding that we got from the legislature to help us enforce the system. So I think we had 15 million to help enforce, and this is for all
Yeah.
state properties. Anytime we have issues with illegal campers in different areas, it's the DOT staff that goes out to address them. So we have 2 full-time employees that are running almost 24/7 crews to make sure we address different communities in different areas. We normally coordinate with the counties to ensure that we don't clear a portion of state land, they move to the county and vice versa. We'll try to push our coordination. So those 2 are necessary because they work split shifts a lot of times. And a lot of times one is coordinating with agencies while the other is doing the work in the field.
Okay, so you are working in conjunction with
Yeah.
the city.
Yes, absolutely.
Yeah.
Any other questions? Go ahead.
Overtime summary
Which did you,
on admin
admin?
11, table 13.
Okay, so page 242.
So I noticed the 11%, 12%, 10%, the first 3, 18%. But the dollar amount, 2 million and stuff, is that, did we get another employee to
Admin.
balance out the cost? Or we're in general.
Oh, highways.
Highways, I'm sorry. Sorry.
Okay, so that's,
Grab to come up. Oh, no, you can see her.
that's page 145.
So table 12, is that? Oh, is that okay?
Table 13.
Oh, 13, okay.
First, let me just say this. Thank you for not bringing the entire department. I know that they're working, like everybody else filled this room, so I really appreciate that. And also appreciate that for highways, you had no teleworking, for airports, no teleworking, which credit you for that. And that for a number of your travel, you gave us really detailed like interviews pending, which we appreciate, but not every one of your departments did that detailed work, but.
I'm watching right now.
Yeah, so that's appreciated. But that was, I think, airports, but not necessarily in harbors but we appreciate that level of detail.
Thank you.
But now, can you explain the overtime and, if we want to maximize, perhaps you need to employ another body?
This is for Oahu and Hawaii highways. Those two, the first two. Or first three, I guess. Maui.
First three and then.
And then Kauai.
There's 18%.
Yeah, that's the highest.
Yeah, so the biggest overtime you see is at the districts, and it's all their maintenance folks. So a lot of it is the blue collar workers that are responding to emergencies, to address the vegetation overgrowth. We give them a lot of overtime. That way they can, go out before peak traffic. So they start early in the morning and or work on the weekends or after hours. So that's the two
But
major.
partly this is due because you can't use the same pesticide.
Correct. So because of that, more labor intensive. And I mean, if we could hire more bodies, then yeah, definitely we would, but with the staff we have.
Cost effective, whether hiring another body would be more cost effective than giving.
Yeah,
Mhm.
we have,
People want to spend time with their families as well.
Yeah.
so.
we
Well,
have positions open that we have on continual hire. We just can't get enough increase on the system, especially given the needs that we have right now.
Yeah, and actually, initially when we would offer overtime, at least, when I was at the Maui district, we would give them on the weekends, and we wouldn't get that much because, like you say, they want to spend time with their family. But then when we said, start at 6 instead of 7, or work till 4:30 instead of 3:30, then they're like, oh yeah, they're more open to that because an extra hour or two here during a work day anyway, it didn't affect too much what they do on the weekend. But yeah, we can look into see what the cost effectiveness is.
Yeah.
Overtime is at time and a half, but you're not necessarily paying for the additional benefits, more medical,
That's
more
true. That's why
retirement
we
or
need to
retirement
speak
does.
on
Yeah,
that.
so I think there's
Yeah,
some
we can take a
savings
look
in
at
that.
that. And I think what we can show is from last year, our overtime overall is down. The percentage, the number is up, but that's because the salaries are higher, which is a good thing. But the overtime percentage is down. We'll take a look at that, and then we'll also kind of tie it to how we offer the overtime on Kauai. I know there was a group of senators that toured the west side, and we got them stuck in the traffic out there. Not on purpose. It wasn't on purpose. But since that time, we have adjusted our maintenance to start at 2 a.m. so that we're out of the traffic during the daytime.
They were trying to get those opihi.
Yeah. Yeah. So
Budget briefings 2 a.m.
For highways, just to add, and we can talk about it in our briefings coming future, but you have the employee portal, but whenever you have employees on any of the islands and on the highways, when they see a crooked sign, can you tell them stop the car and fix the sign? I see it here, I see it on the big island.
She's out there by herself trying to fix it.
No, but I'll tell you what I do though, if I'm traveling, no matter what island I'm at, I always have a rubbish bag in my car. And if I have time, I do. I
No,
but
she
the
can't.
good
We
thing, I
know,
pull
because when we have website visit, you have all those Ziplocs. We all huge.
always.
Yeah, you are.
Yeah.
Yeah.
So Senator,
stuck in traffic with your food.
yeah. Senator, I think what we can add to that is when our staff is moving on the system, in general, they're trying to get to a location. So I don't know that they see it all the time. What Robin had added to the system now is this Eyes on the Road program that put out 1,000 dash cams in the system. That dash cams are taking pictures of the system throughout, sending that information to our consultant who is running an AI model to ensure that anything out of the norm is flagged so we can address it. So we'll put sign alignment in there as one of the priorities.
Interesting.
Good. And when you first got elected as DOT, you remember I picked up the phone call, punch bowl, when we're getting on the highway. I don't know if you guys noticed that, but nobody did. The sign is crooked right before you get to the tunnel at the point of Vineyard and Punch Bowl. That sign is always like that.
Yeah, but you know what? If you slant your head, it looks straight.
Okay, but anyway, just tell them they see something, just go fix it.
Senator Favela.
Just like, we did the asphalt in Ever Beach. Do we have any reports on how that new technology and future, if we're gonna continue that technology on the asphalt?
Yeah, we tested a couple of technologies out there. One was plastics and pavement. The other is increased wrap or recovered material into our pavements as well. And all of them are operating well. We wanted to make sure first that it wouldn't be leaching into the environment. So we did significant testing with UH prior to putting it out there. Once we tested leaching and it wasn't a problem, we put it out there to make sure we could get the mechanical resistance of the material. And it's been performing really, really well.
It's still good.
Yeah. Well, what kind of feedback are you getting from the public?
They like it. I mean, it's more, it actually, tell you the truth, it's more smooth. And you can see the difference when you get onto that area.
Yeah.
It's a different.
Okay, it's not usual that side asks the questions, but.
Oh, sorry.
That's fine. That's fine.
Tell the difference on the road. It is different.
Awesome.
Okay, any other question? Oh, go ahead. Oh,
Go ahead.
I don't know
Go ahead.
which farmer's gonna go.
So the rancher got away, we did cattle yesterday. Anyway, it's, you know, the pavement, asphalt that you guys using. I'm told that you guys using a different type of asphalt.
Yeah.
And the needs for, environmental, is it more, efficient that you guys using this type of, only because we are dealing with the CRB, we on shortage on Molokai, our challenge is trying to get clean asphalt.
Yeah. So we're using much better asphalt than it was before. And you guys can remember, right? In the past, when we use our normal mix for, after 7 years, that stuff is raveling already.
The one rainfall is rough.
Yeah. Yeah. So we wanted to make sure that we put in something that's going to last the 25 years that the CIP requires. So we're using polymer entrained asphalt and stone matrix asphalt. Those were tested by us on the system and nationally to make sure that it's a better product that lasts a long time without the leaching into our environment. So this is much better material that we're putting in. It's a little more expensive on the front end. It takes a little bit longer, but it's much better.
Is that the one they're using right now on highway? Once you get off Nimitz, you're getting on the freeway, going into the airport entrance on the top. I noticed that's a different type. Is
So
that the new one?
That's a different one. That's a sealant. So we're putting a sealant on top of the viaduct. If you go up the viaduct,
Yeah.
you'll see that get plenty of those areas that had those cutouts and repairs, right? When it was built, that viaduct was built with very thin cover over the steel. That steel was rusting. And because of that, the top of the pavement was peeling off. So we were trying to chase it for many years, trying to repair it, and it made no sense. So what we did instead is we got in front of it. Got in front, made sure we repaired portions that we needed to that was peeling off, and now we're sealing everything. The problem is water was getting into it. With this new sealant, you get better friction resistance, so you get better control on your car. You can stop better. It looks better because you don't see those cutout cracks all over the place. Rides smoother, and now water cannot get in. So now we get another 20 years on the deck versus just trying to repair it.
Ed, what does Vietnam use? Because when I went to Vietnam, there was no potholes. And
You had any cars out there?
But they might have a different like non-environmental standard.
like to the jungle and all that, and the storming and rain, potholes. So I came back, I called World Contracting. I said, what are they doing that you guys are not doing? And he said, they go down, instead of go down 6 inches, they go down more.
Yep.
And so it's a deeper and you know, sometimes only surface. So is that what the problem is? Or is it the material?
You're exactly right. So in the past, that's what was happening. In the past, and I would just use this as an example. In the past, what highways was doing prior to 2014 was just painting the system black. You get a problem on one system, rip out an inch and a half, put down another inch and a half. And we do that, look good for 5 years. After that, you get the same problems again. We refuse to do it that way.
Okay,
So anytime we go up to the system, we reconstruct the pavement. It's for two reasons. One, you cannot fix a structural issue just doing superficial portion. And the second, all of our roads were built in the 60s for 60,000 vehicles per year. I mean, it was a small amount that we consider. Right now, we get 270,000 going through that IA Pro City corridor. So we want to make sure that the pavement that we put in place structurally can hold the volumes that we have now.
So what's the repaving yearly? Like was every 9 years or every 10 years that you repave?
Right now, we put it on a schedule so that we make sure that we can address it incrementally over time. So right now, after 5 years, we inspect it to see if we got a crack seal and check areas so we can minimize the amount of water going in. After 10 years, we're looking at fog sealing everything, to make sure we can refresh the pavement. After 15 years, we're looking to see if there's portions of the pavement we need to reconstruct. After 20, we're looking at to see if we have to re-mill and fill and re-crack seal. So we have a plan in place to ensure that every piece of pavement we put in, we're monitoring over shorter times versus the long periods.
My district,
We'll do.
for chapter.
We'll do. Your question.
Okay, so my second question is, in Hana, as you know, I know you guys always looking at the bridges and stuff. You guys looking at any options as maybe casting the bridge, like how they do it, the military, especially all the 3D programs that we're running now.
Yeah.
Versus we shutting them down and then it
Yep.
would take 3, 4, 5 years.
Absolutely.
There options that you guys looking at?
Absolutely. We're looking at two different things. One is building the same type of bridge we have right now, but on the side and sliding in place over a weekend. And second, we're looking at using different materials. Because one of the biggest problems over Hana Highway is the limited loading that you can put on the system. So if I can do something without a crane, I can just use one grade all to drop something in place, better for everybody. So looking at those different types of materials to ensure that we get the strength we need at a lighter load, so we can minimize the amount of time it takes to build those pieces in place. So I mean, what we did on the west side, we built the Maka bridges on the side of the road, and one weekend we shut them down and slide them in place. Yeah. So
You guys did them in Kauai too as well.
yeah, exactly. So it's those types of systems we build.
But I just wanted to thank you guys because I do see a lot of the guys and Robin thanks on Molokai that, they're working on the weekends, which is good. Because, the pesticide issues and stuff. So they go in and I know that the equipment would break down. So-
Yeah.
And it's hard to get mechanics in, so.
Yeah, the cool thing is everybody who drives on Hana Highway either get one chainsaw or a mechanic in their car, so they always know how.
Kind of like Kohala.
Thank you.
You gotta get one chainsaw in your car.
I get everything.
She get ready. Right next to the rifle.
Just in case.
Hana and Kohala have a lot in common. Directors,
Yes.
thanks, appreciate it. A couple of questions and again, this is for the supplemental funding I get, but I want to be sure that our funding is in place. And as you know, I got planes, trains, and automobiles in my district. Kona Airport, the surface for the runway, Hamakua, that highway, I mean, that thing is settling very strange and we got a lot of problems there. Quite high, that expansion and reorganization for that harbor, and then DKI. I mean, is our funding, I know a lot of that was federal. Are we looking good with that right now or?
The funding is looking good. First, on the airfield portion for Kona International, we have the funding in place. The project is moving and will be done by the end of this year.
This calendar year?
Yes.
So my cattle airplanes can fly
So
again?
that's not the reason the
Yeah, I
cattle
know, I
airplane's
know,
not
I
flying. But yes, it'll be done before the end of this year, and the funding's in place. We've had a couple of shutdowns that were necessary because of cracks that were forming, and unlucky enough, we were doing portions near the areas that were failing, but it failed before we could get there. So we're making sure that we minimize the impacts to the public with that reconstruction, and that's all funded.
And I think the public should also know that the repairs that you made were not the things failing again. It
That's
was
correct.
like you said, you hadn't.
There's no refailures, exactly.
Okay.
On the DKI extension, that's a portion that we're working with the military on to get
Right.
the funding. And I should tell the committee that our relationship with the military has been significantly tremendous. They're such good partners. So they're looking at putting 60 to 70 million into DKI to offset the costs, to make sure that we can bring up the priority of that project to move forward sooner rather than later. We've been working with them to get additional funding in many different areas. And one of the things that we're doing with them right now is becoming their local partner. So instead of them going to contractors or contracting on their own, they're going to use us to do their work for them.
I like that.
So we'll do their roads and their airfields for the military. The reason we do it is twofold. One is to make sure we enhance the partnerships that we have, so we can benefit from things like Kole Kole Pass being used in different areas and other opportunities we may have. Second, the military could not put out enough work to use up the funding that was available to them. Now, if we can do it for them, we can increase the amount of funding that comes into Hawaii. And because they will allow us to use our contracting methods, we can contract locally versus them going nationally to contractors who would come in, do the work and leave. So it helps us in all different ways, especially with this new federal administration who is prioritized military. That's where the funding is going to go. So we'll be there with them to ensure that we can bring more in from Hawaii.
Okay, any other questions?
Oh, sorry, there's
The
more other
harbor,
pieces.
the harbor, the expansion of High Harbor, you know, the putting in the turn lanes and all that.
That's all set. Yes. Yeah. No, and that was a partnership between Robin and Dre to get that portion
Yeah,
done.
right on. Thank you.
Can you just give us an update of the drug lab that you're supposed to be working on?
No, well, previously they said it's contracted out, right?
Well,
And it's contracted out right now. So the services are being done by Oahu and sheriffs to make sure that currently it can be fulfilled. We're still moving forward with the drug lab now. We've identified space that we're pulling in now. We're identifying the funding that's necessary for the equipment that's necessary to take care of all blood, alcohol, and drug.
Blood and alcohol.
Yeah, and of course, this is leading towards a long-term need for a drug lab for other purposes as well.
So this will be moving into a permanent
Yes.
drug and alcohol lab.
Yeah, exactly.
And a time.
Who staffs it?
So right now, we're working with Department of Health to provide staffing there. So we would fund the positions. And Rob, please know.
No, that's fine.
We'll
That's
get you
fine.
information. Yeah.
Senator Kim.
Yeah, for airport.
Oh,
Oh, sorry. What are we doing?
No, it's good. Yeah, that's fine.
Okay, airports. A question regarding the thermal scanners.
sorry.
Um,
From COVID.
yeah, the thermal scanners. Okay, first of all, how much money did we spend for this whole program? the
I
thermal
don't
scanner?
I don't have that number specifically, but the thermal scans, the infrastructure is there, but the prior deputy director disabled those systems.
So they're in storage.
Yeah.
So how long did we use them?
During COVID, so whenever it was installed in 2020, 2021, until it was deemed safe, so probably a few years.
Okay, and so do we have a cost analysis on what it cost us? And where all the funding came? Because I understand that 37 million of that came from the CARES Act funds.
That's correct. It was CARES funded, but I
But it
can
was-
get you that
was it
detail.
all?
No,
Yes, it was-
no special, because it would be special fund, right?
Yes.
So it's just all federal fund.
Yes.
Federal funds on that one.
Those-
Okay,
yeah.
and so there was a maintenance program for these cameras. And there was a 10-year maintenance program. Did we enter into that 10-year program?
Those are all canceled. Those are all canceled. So it's just unfortunate. I think that system could have been repurposed and reused. But so the conduits are all there, the shells are there. We just have to reinstall software and some of the cameras
So
again.
what would we use? What need is there for that infrastructure?
Well, it wouldn't be just for body temperature, but you can use that for other purposes for security. You can
Well, I'm sure we can use it for anything, but what's the need? I mean, we're not going to just use it to use it and spend money on it. But, when we make this kind of large expenditure, and I understand COVID, but at the same time, this was a lot of money was being spent, and not just here, but across the state and across the country, of stuff that went out like that. And so we're stuck with a lot of this cost. And, and the reason I'm asking is somebody actually sent me a thing about, all the costs and where an audit was done and what's the justification, how could we spend all that money and what's happened to it? Because the public is not made aware of whether or not these scanners are being used. I wasn't aware of whether these scanners are being used.
get your updated report. But as you know, in the airport, as we did for the state buildings, the volume of people coming in and out were much less. At the airports, they're dealing in the thousands, tens of thousands. And so you needed a system to scan quickly. And so that technology was applied. I recall that. But in terms of it going forward, it was disabled. There are no more expenses associated with the system today.
A lot of things that was employed during COVID, supposedly cleaning type of things, and then they found it wasn't effective, and then we bought something else, masks that wasn't effective, and other kinds of masks. So there are a lot of things going on, and I don't know that we really used a lot of discretion as far as looking at the long-term value of some of these things that we were purchasing. But now, like you said, they get dismantled and put on the side and, nothing. So
Right.
can we get a report? on that?
Yes, ma'am.
Chair,
Sorry, airports. Duty Free Shoppers is closing its doors here in Hawaii. I know that it's been a big revenue driver for airports. How does this negatively impact?
No impact.
Okay.
As soon as they close their doors in March, in April, we have iShops starting up. So we just walked them through the system this week so they can look at all the areas in Honolulu and in Maui that they'll take over for retail and for duty free.
Are you guys able to retain the employees?
So that's the first conversations they had was with the duty free employees to ensure that they can start employing as many as they see fit.
Great, thank you. Thank
Do
you,
you know
Chair.
if they're closing down the Waikiki shops as well?
Yes.
They are.
Yes.
They're completely going out of state.
Yes.
Okay, any other questions?
Yeah, I was kind of mad. I couldn't even shop in on our property. That wasn't right.
The number one shopper of the state.
Okay, if no questions, adjourn.
Thank you.